Hello everyone, good evening. So here is Team Cerebellum for the recall session of INI-CET May 2025. Good evening Vivek sir, good evening Apur sir, good evening Anand sir, good evening Devani ma'am.
Hello everyone.
So guys, our initial impressions of the exam, slightly tougher exam. Uh, we were just having a discussion about the number of questions which were from PYTs or PYQs. So one of the consensus that is emerging is I think the questions were pretty much from PYTs, at least 70-80%, but 20% questions were new as well. But even the questions that were from previous year topics, they were a bit twisted. They were not all straightforward. Some of them were sort of straightforward, but some of them were either twisted or they were made clinical. So in fact, we were just discussing that these were the kind of questions that we also created for our INI-CET mocks. Paper is looking quite similar to that. So a balanced paper, not very easy, not very difficult. Questions from topics that are usually asked, but question asked in a different way, in a new way. So we would also like to understand what you guys think about it. But let us start with the recall, and we want to keep this recall precise, quick. Apur sir, can you start with the recall, please, sir?
Yeah, thank you very much. And first of all, I would like to thank the team of Cerebellum, which is working for the last 7 hours non-stop under guidance of Dr. Praveen sir and all the seniors to collect the questions, present them so that the students can have a grasp and so that we can discuss in a very short span. So let me come with the ortho questions. Let me share the screen, please. So when we look at orthopedic questions, so we will be getting exact options and exact language very soon. But if you look at the question number one is exactly a recall that came in NEET PG last year. They had asked in two different segments, two periosteal reactions, and this time they had asked you the combination of both the reactions together, that it Codman's triangle and Sunray appearance is seen in. This means they want to talk about a tumor which is rapidly growing, and one of the tumor which is very rapidly growing with these two characteristic radiological appearances is osteosarcoma. One more thing, this was a theory-based question. In NEET PG, this came as an image-based question. So the answer to this question is osteosarcoma. Now let me have a look at question number two. Question number two, when they had asked, this is what they were striking. Tuberculosis is a national disease, and I'm very sure that this is an overlap of radiology, orthopedics, and PSM. They had mentioned that according to WHO, which investigation will be required for diagnosis of tuberculosis of spine. So you need to understand, we need to remember what I always tell in the lectures. Tissue is diagnostic, that is, radiology is always suggestive. So if you remember this, the diagnostic is always going to be tissue. So X-ray and CT scan will not be the ones. Now we have two options here, CBNAT and culture and sensitivity. So if you look at the specific diagnosis which has been adapted by WHO right now, the CBNAT is the investigation of choice from the tissue which is obtained by CT guided biopsy from the lesion which is identified by MRI. So it has got so many things, but the final answer here will be CBNAT, which is the answer in question number two. When we look at the next question again is something where they had very clearly mentioned that if you have a patient of intertrochanteric fracture, all right, and I've been telling you, femur pe question aana hi hai. Treatment of femur, they will always ask you, and at the neck of femur, you replace it. After that, you always put a nail, irrespective of the age. So here the question was very clear. 72-year-old intertrochanteric fracture of the femur. What will you do? The answer is going to be intramedullary nailing. That is what is going to be the answer. All right. You will choose intramedullary nailing over DHS. Today's world, nailing is preferred over DHS. This is an exact question which came in INI-CET and NEET PG in the last go. Let's have a look at the fourth question that came in orthopedics. Now, this question I'm very sure Dr. Zainab will also discuss with you. But since the students in Cerebellum Telegram group tagged me into, so I have included it. The Honda sign, Honda, the car Honda, the city Honda car logo is identified in sacral fractures, insufficiency fractures. This will be covered in detail in radiology. So I just covered because I was tagged by multiple students. So the answer here is sacral insufficiency fractures. Now we go to the next question. Next question again in orthopedics is a clinical based question. And they have mentioned here a long history, but they want to talk about the keyword anatomical snuff box. You know, whenever they talk about anatomical snuff box, any student appearing for entrance has to think about which bone? Scaphoid. So they have to think about scaphoid. And when they want to think about scaphoid, they have to remember one thing in scaphoid. You do an X-ray and then you do an interval X-ray at the day of 10 or 14 to identify the fractures. So what you will do, you will splint the part, give analgesics and ask the patient to come back for repeat X-ray after 10 to 14 days. That is the next best step in this patient. So this is what is a clinical scenario based question. I will not say this is a direct question, but this is where if you have been into the clinical postings, what Dr. Praveen sir said, PYT based clinical scenario. And if you have been into clinics, you can get this correct. And now let's have a look at the last question in orthopedics, which again spoke about, which we always say, rheumatoid arthritis is a young female bilateral hand pain, and your hands can reach at the upper cervical spine. And when any patient of RA or arthritis has cervical symptoms, you will think about C1, C2 abnormalities. That is atlantoaxial instability. So this is what is there. Now this, all the 6 questions which I have discussed here, we will be recording a detailed video and we'll be putting it in the app, right? And we'll also be notifying all our subscribers, right? This is what I want to talk about ortho. We can stop the sharing and over to Dr. Praveen sir for his questions. Thank you very much.
Thank you, Pur sir. Thanks a lot. So students, Vivek sir, with your permission, can I start with psychiatry, please?
Yes, sir, absolutely.
Thank you, sir. All right, students. So let me quickly go through the questions of psychiatry now. So I'm very happy that there were 7 questions. First of all, I'm happy that there were 7 questions. Last time there was only 1 question. I was pretty depressed. This time 7 questions. And secondly, I'm also very happy that we covered all these 7 questions in our mission classes. So let us start with the psychiatry first question. This question, I think all of you must have gotten correct. This question is a direct previous year question. A woman planning for pregnancy, which of the following drugs must be avoided? This exact question, exact language was asked by INI-CET or NEET PG a couple of years back. And all of us know that the answer is valproate for neural tube defects, right? So सबको पता है. All of you must be aware of this. Valproate, no confusion. ठीक है? Second question. All right. Second question. All right, again, a very standard question. We had discussed this in details that in acute mania, what all drugs can we use? We know that we can use mood stabilizers. We can use antipsychotics. So we have got 2 mood stabilizers here. We also know we can use antipsychotics. Incidentally, in the class also, we took the example of haloperidol only. So INICET gave haloperidol only, thankfully. So 1, 2, and 3 are correct. Option B. Again, I'm sure all of you must have gotten this question correct. Okay. Third question. All right. Third question, which was a googly. Interestingly, this line is a direct lift from Neeraj Ahuja book, the short textbook of psychiatry. This exact same line he has given. So a patient with schizophrenia comes and says that Lord Hanuman was celibate. I am celibate too, so I am Lord Hanuman. Which thought abnormality is present in this patient? I think a lot of students got it incorrect. The right answer is autistic thinking only. This is a kind of, it is called a syllogism, von Domerus law. Basically, in autistic thinking, what did we study? That there is a lot of fantasy thinking, right? Patient makes random rules. So in this patient is saying Lord Hanuman is celibate, I am celibate, so I am Lord Hanuman. This is autistic thinking. Verbigeration you could have easily ruled out. It's a kind of perseveration. It has to be done repetitively. Neologism you should have ruled out. There's no new word here. And in loosening of association, I think a lot of you mark loosening of association. But see, there is loss of context in loosening of association. यहाँ कहाँ हो रहा है? Right? There is proper context here. So the answer is A, autistic thinking. I think a large number of you found this question difficult. It's okay. चलता है. All right. Next question. All of the following statements are correct except. So I think you could have looked at the option C and could have answered that this is the wrong statement. Flumazenil is used for benzodiazepine toxicity. It has got nothing to do with the long-term management of alcohol dependence. This is correct. Opioid intoxication can be fatal. Opioid withdrawal is rarely fatal. This is, of course, right. Buprenorphine is used for the management of opioid withdrawal. And this is also right. Cannabis does not really cause any physical symptom, mostly irritability and all. Even if you did not know all of this, you could have just looked at option C and you should have marked it. So flumazenil is used for the management of long-term management of alcohol dependence is incorrect. ठीक है, चलिए. All right. Which of the following statements is incorrect? Now, this is a slightly controversial question. We'll have to think more about it. But is the language correct, guys? इसमें थोड़ा help करिए. Please help me. Was this written in the question in the exam? Alcohol in low dose causes brain stimulation and in higher doses causes brain suppression. यही था क्या? Exact यही लाइन थी? Was this the exact line? Okay. So students are saying this is the exact line. So now that makes this a slightly controversial question. Alcohol in low dose can cause behavioral stimulation. That is correct. You know, you must have seen people dancing and singing and doing all silly stuff after taking alcohol. But at the level of brain, alcohol is always a CNS depressant, right? Alcohol is always a CNS depressant. What we see as stimulation is a behavioral stimulation or behavioral excitation. So if this was the language, then the statement A is incorrect. Cannabis use can result in self-driven repetitive behavior. This is a very vague line. Was this the line? Can you verify this? Was this the line? Cannabis use can result in self-driven repetitive behavior. ये थी क्या? Was this the line? Cannabis use can result in self-driven repetitive behavior. So if this was the line, see, any substance can lead to repetitive behavior of seeking of drug, right? Drug seeking behavior. So probably they are talking about it. This is of course correct, and inhalation agents can of course be toxic. So looking at these options, A appears to be the best answer because alcohol is a CNS depressant at all dosages. That behavioral excitation is something different. ठीक है, but ये गुगली थी. All right, which of the following is not an ICD-10 diagnostic criteria for depression? We remember the mnemonic SIGE caps. SIGE is sadness of mood, I is loss of interest, E is low energy levels, right? Energy level, low mood, loss of interest. Option D is not a part of diagnostic criteria. We remember the mnemonic SIGE caps. I hope you got this one right. And the last question, I hope you guys remember me telling you about Elon Musk. That Elon Musk has said that he uses ketamine to manage his depressive symptoms. And here it is. This question was waiting to be given in the exam. I mean, I was waiting कि ये question आएगा ही आएगा और आ गया. So the new psychoactive agent which can be used for rapid onset of action in management of depression is of course ketamine. ठीक है? So great. These were the 7 questions. I hope all of you got at least 5 or 6 correct. And if you were able to think properly, you should have gotten 7 out of 7 correct. ठीक है, Vivek sir, over to you, please.
Thank you, sir. Okay, allow me to share, please, friends. Okay, friends. PSM was okay this time, quite easy, I should say, not moderate.
Sir, आप तो बहुत ही young दिख रहे हैं इस वाली फोटो में, sir.
Yes, sir, I am young actually. Sir, PSM was quite easy this time. It was actually easy, not moderate, I should say. Out of the 19 questions, around 15 were easily attemptable by anyone and everyone. And I'm sure other 4 also, most of the students have attempted correctly. Let's quickly go through the questions, friends. Let's look at the first question. Here we were asked incidence rate. So quickly we apply the formula. Total number of new cases upon total population at risk. 10 had already developed measles earlier. That means they were no longer susceptible. So 90 were susceptible and it is calculated per 1000. So that will come to 22.2. But they asked in percentage. So that will come C, 22.2%. Please remember, those who have developed the measles earlier or got measles vaccine, they are always immune. They are no longer susceptible. And denominator of incidence always includes at-risk population only. This question was on dependency ratio. Again, a repeat question, such a easy question. Dependency ratio is non-earning upon earning population. Non-earning is below 15 and above 65. So a total of 6,000 and 2,000 divided by remaining 15 to 64-year population, that was 12,000. So this was a direct question, direct formula, easy 0.66. So we can call it as 66 non-earning depend on 100 earning for survival. If you remember, we took the same example in main videos also, and mission classes also. Answer came 0.66. Question 3, organize the following steps in correct sequence. I think again I should say this was one of the easy questions. Remember when we discussed the classification of epidemiological studies in mission classes, main videos or rapid revision videos, you must have remembered what was the first thing. First thing I always mentioned was make a hypothesis. Possibly smoking is the cause of lung cancer. Possibly INI-CET exam is going to come very easy, right? So make a hypothesis. Then you draw your research objective, design how I'm going to do. Should I take a cohort study, case control, cross-sectional, ecological? Then select your population and finally do data analysis. So choice number C. Your research study always starts with research question. अगर आपका question ही नहीं होगा तो आप study क्या करोगे? So you need to have a question in front of you first. Then you proceed forward with the study design. Question number 4, find the incorrect combination. This was a fairly easy question. Biostatistics, I think, was very easy this time. Mean and median are not measures of dispersion. They are measures of central tendency. Standard error represents one of the types of variation or dispersion. Coefficient of correlation that we find through a scatter diagram is a relationship between two quantitative variables, and skewness is when data is not symmetrical like normal distribution, it is asymmetric, right? So that was an easy question. We were asked to find out incorrect combination. Okay, student, in this question there was a confusion, so please let me know. Two types of questions were told to me by the student. One was maintaining the medical records. Second question was data security and privacy, because your answer will depend on this. So could you please kindly confirm in the chat box? I'm looking at the chat box. Okay, skewness was moments, that is correct. Can you tell me about what was in this question? Maintaining the medical records or the data security and privacy? If it was related to security, then in the main videos, if you remember, National Digital Health Mission, this is responsible. For data security, overall for maintaining medical records, your favorite body, National Medical Commission, is the answer. So depending on the language of the question, maximum students are saying data security was asked. So we now have National Health Authority, National Digital Health Mission, right? Okay. Quartiles, tertiles are measures of. This we have discussed in our mission classes, live classes, rapid revision, everywhere. It is locations. So quartiles, tertiles, pentiles, and centile. These 4 examples I gave you, right? So let's move further. Which of the following is not a component of RMCH plus A strategy? Again, in mission classes we discussed. So students who have attended the mission classes in detail, I'm sure they must be feeling happy today, right? So reproductive health, which will include family planning, maternal health, newborn health, child health. Plus A is adolescent health. So depending on the choices, you'll mark the answer. In case any choice is not matching as of now, friends, don't worry. Idea is to get the question correct. Any choice I have missed somewhere, I will leave my mobile number with you. Please feel free to WhatsApp the correct choice or the language of the question. It is my personal number in case I have missed somewhere, right? We will correct the language of these questions subsequently. This is based on what students have told me. As per MTP Act of India, 2 doctors' opinion, this I think we have discussed. Low risk below 20 weeks, 20 to 24 weeks, 2 doctors' opinion is required for doing MTP, right? Okay, same question was there. Then another question, were there 2 questions from MTP Act of India, because they asked minimum age for undergoing MTP. So what the MTP Act says, Dr. Atul will also confirm this. We'll go by the forensic answer ultimately. Actually, the minimum age for undergoing MTP is 18 years. But in cases of minors, then a consent has to be taken from the legal guardian. And students told me that actually the consent was, nothing was mentioned about the consent in the question. So friends, look at the minimum age generally is 18 years, but below that also it is permissible. No defined lower limit I could find in the MTP Act of India. Still it is 18 years. Below 18, it can be done with the consent from a legal guardian. This we have to remember. There was a question on Mahakumbh Mela. What was the purpose of mobile medical vans? Older question. Remember, mobile medical unit was asked in INI-CET few years ago. So this is same. See, this question you can solve logically also. It will not be to reduce the number of health workers. Why will we quarantine hundreds and thousands of people? Yes, it can give us some information on early outbreak of diarrhea, respiratory infection, but mobile van unit, we have discussed in levels of prevention. What is the major purpose? Secondary level of prevention. To diagnose with lab test, and they are fully equipped to give primary care as well as management of common emergency problems. This you have to remember, right? Okay. Then there is a question on medical officer at PHC collecting data for disease burden. You divide diseased people into mild, moderate, and severe groups. Groups means strata or layers. You are doing stratification. And after that, you are selecting units from each group. Now you are doing sampling. So this is stratified random sampling. Stratified random sampling. Best timing for copper T380 insertion. Please, could you please confirm, was this actually asked in the question? Good compliance. Was this the exact language of the question? I'm looking at the chat box, friends. I'll give 15 seconds because there is a delay in the live transmission always. Okay, if it was multiple options in this particular question, then we know this is done immediate postpartum and within first 7 to 10 days of menstrual cycle, this is considered best. So if multiple response option, this question was there. So RCH program says best is within 48 hours of delivery, but we can also do immediate postpartum and within first 7 days of a menstrual cycle according to RCH program of India. Not given to a child with, if we have discussed already in the mission classes, if there is an immunodeficiency, vaccine contraindicated is live attenuated vaccines. So MMR is live attenuated, it is contraindicated, others are reasonably safe to be given, right? Okay. Okay, this was a question from communicable disease, vector-borne diseases. I told you that rickettsial disease table, we have to remember, question will come on either vector or the reservoir. So we know Rocky Mountain spotted fever is tick, rickettsial pox is mite, epidemic typhus is known as louse-borne typhus, endemic typhus or murine typhus is known as flea-borne typhus. So this is C, D, A and B. Choice number C. The order of the choices, of course, may be different. This is what students have told us, right? Okay. Black fly, in case it was in the choice, one of the student is asking, black fly, if it was there, it is the vector of a disease which does not exist in India, onchocerciasis. Among all the vectors, black fly has the highest flight range also of 100 miles, right? Which of the following is not a high-risk group for HIV, friends? This was an easy question, repeat question from previous paper. If you attended the INI-CET session yesterday, this was there in that session also. Long distance truck drivers, according to National AIDS Control Program, is bridge population. When we look at these three high-risk groups, how do they transmit disease to the general population is via the bridge population. So long distance truck drivers come in contact with commercial sex workers, and these are the bridge population. They take back infection to their spouses back to their homes, right? Okay. Definition of blindness, one of the easiest questions, less than 3/60 after best possible correction. Definitely. This is the same definition in National Program for Control of Blindness, Visual Impairment, as well as WHO definition currently, right? Okay. In a group of patients with diabetes, look at the question. Their weights were compared before and after. When we look at a quantitative variable like weight, what are we looking at? Metric data. So best measure of central tendency, mean. So you are comparing mean before and after an intervention. So this is paired student t-test. If they tell you diabetes in males versus diabetes in females, we are comparing their weights. Then it will become unpaired student t-test. If they compare proportion of diabetics before intervention to after intervention, that is sign test. If they compare proportion of diabetes in males versus female, that will become chi-square test, right? Okay. So I'm sure everyone has attempted all these questions so far easily and correctly. Okay, friends, this you will have to help quickly. I'll wrap up the session. There was some question where in the choice Ayushman Arogya Mandir was given. So can you tell me if there was a question on this, friends? Okay, in this question, if there was a group of 100 patients, if sample size is mentioned and the choice also mentions Z test, then Z test is going to be a better answer. This we have discussed, right? Okay. Okay, there was no question on Ayushman Arogya Mandir. Okay, I delete this question. Otherwise, it is the new name of Health and Wellness Center at many places. Was there any question on prevalence? Could you please confirm? I'll quickly wrap up the session. If sample size was not mentioned, or even if sample size was mentioned and only paired student t-test was in the choice, then paired is a better answer. Okay, there was a question on hypertension, friends. I'll make structure the question with your help. I'll leave my number with you. There was no question on prevalence, only on incidence. Was there any question on HPV vaccine strains? In case it was there, we have discussed. Most common in India is 16-18. 6-11 is second most common. 31-33 is third most common. So we have Cervarix, which is bivalent. We have Gardasil, which is quadrivalent. We also have India's own vaccine, Cervavac, which is quadrivalent. And we have a nonavalent vaccine, Gardasil 9 also, which includes 45, 52, and 58 strain also. Right? In case there is a question on human papilloma vaccine viral strains. Was there a question on Western blot assay? I presume it was more of a micro question or a biochemistry question. What I can tell you from National Health Program, AIDS Control Program is, it is based on proteins. We discussed, if you remember in the class, it is a protein-based test. So Southern is for DNA, Northern is for RNA, and Western is for protein, right? Okay, friends, in case you find any other question from RCT, trial, health and disease, screening, healthcare system, international health planning, management, communication, environment, nutrition, please, you can send the question to my WhatsApp number. Audio, text, written on a paper as photograph is also sufficient. And friends, I believe you have done amazingly well in the paper. PSM was easy as expected this time. I wish you all the best. May you score marks much more than what you are expecting. Thank you so much. Whom should I hand over the...
Sir, to me, good evening, sir. Is my voice coming?
Yes, Dr. Anand, sir, please, you can take over. Bye-bye,
Thank you
friends.
so much. Ji. Thank you so much. Good evening and regards. My name is Dr. Anand, and today we are here for the INI-CET recall questions. I hope my voice is coming. The first question we had over here is that aneuploidy is not seen in what? Klinefelter Bloom trisomy 21 and 13. The best answer for this question is Klinefelter syndrome. Question 2 about milestones at 9 months. Baby cannot sit without support. So sitting with support comes by 6 months, and sitting without support comes by 8 months, and standing with support comes by 9 months. He can say Mama Dada and stranger anxiety is present. So Mama Dada means bites labors. Bites labors comes by 9 months. So what option do you want to give? The best answer for this question is option number A. Reassurance would be the best answer for this question. Now, since next question we have malnourished child with the who develop hypophosphatemia and hypomagnesemia. So we all know this is a mechanism of refeeding syndrome. So the answer was option number A, refeeding syndrome. A child with non-bilious vomiting 3 weeks after birth, but normal abdominal distension. So non-bilious vomiting 2 to 6 weeks of baby. The best answer is CHPS, congenital hypertrophic pylorostenosis. Which of the following is not seen in Turner syndrome? It's a good question. Please remember, prominent occiput, it is seen in Edwards syndrome, not in Turner syndrome. So prominent occiput is the best answer. Which of the following is not a cause of stridor? Laryngomalacia, laryngeal web, laryngeal stenosis. These all are the causes of stridor, but hemorrhagic polyp is not. ब्रेस्ट मिल्क जॉन्डिस, जितना मदर अपने बच्चे को दूध ज्यादा पिलाएगी उतना ज्यादा जॉन्डिस होगा, और वो जॉन्डिस होगा अनकॉन्जुगेटेड हाइपरबिल, सेकेंड वीक ऑफ न्यूबॉर्न पीरियड के बाद होगा. And yes, beta glucuronidase enzyme is involved. So you can say all are the best options. Krishna, थोड़ा कम कर दिया इसी. Tetralogy of fallow, a big question was there, and the question was which of the following is not a component of tetralogy of fallow? So ASD and LVH is not a component of tetralogy of fallow. And last question, 36-weeker baby with breathing difficulty and prove with FiO to 30%. And one of my junior Priya, she said that the whiteout lung ka picture aaya tha. So this is a whiteout lung 36-weeker baby. I think so. The best answer for this question is hyaline membrane disease. So I would like to hand over the mic to my ophthalmologist, who's a wonderful person and who is in Vietnam. Sir, is my voice coming to you? Thank you so much.
Thank you, Dr. Anand. Thank you for that very quick recall. I believe you are traveling and still managed to do that recall. Thanks, and hats
Same
off
as
to
you.
your dedication. Hats off to your dedication. My voice is clear as Dr. Anand confirmed. So I'll share my screen now. Just a minute. I hope my screen is visible now. Okay, and quickly taking you through the ophthalmology recall questions that were asked. See, one question that was there, are the following are used in amblyopia therapy except, the question was except, okay, except, ठीक है बच्चों, except में there was strabismic surgery, patching, refractive error correction. We know amblyopia, the first and basic rule is that you have to do a refractive correction that is there, okay, that is for your anisometropic amblyopia, है ना, you have to do it. Patching तो we all know is used for amblyopia therapy. Strabismic is also for your strabismic amblyopia. For that also you can do a strabismic surgery. That can also be done. Video game, I believe, should not be a correct answer. It is not video games. There are no games that you would advise because video games would lead to increase in the myopia. Okay, ठीक है. Is that okay, बच्चों? Is that okay? Is that question correct? Waiting for your confirmation. Just quickly, this slight delay. आ जाओ फटाफट. वीडियो गेम्स, हाँ वीडियो गेम्स कौन देता है, ठीक है, वीडियो गेम्स आर नॉट, ठीक है, देयर वाज नो ऑप्शन. ओके, ठीक है, चले आगे. मूविंग ऑन टू नेक्स्ट क्वेश्चन. क्वेश्चन नंबर 2, देयर वाज एन इमेज बेस्ड क्वेश्चन, ठीक है, वीडियो गेम, दिस इज इमेज बेस्ड क्वेश्चन वेयर दे हैड गिवन अ बेसलाइन. They had given this second image where they had shown both the eyes had gone to one side. In the third question, they had shown that the right eye was not adducting and the other eye was going into a nystagmus. Okay, this I've told in the class also, that one eye has gone on one side and looking at the other eye. Okay, it is dancing at the other eye. So I give the example in Jacqueline Fernandez is calling me and I'm looking and then there is a dancing. Okay, dancing, yes. So this is internuclear ophthalmoplegia. This is internuclear ophthalmoplegia. Left eye, right eye, left eye subcurvature is there. ठीक है, internuclear ophthalmoplegia, INO. Okay, हाँ opposite होगा डॉक्टर वार्षिनी, but हाँ, but there was this question that one eye is not adducting, the other eye is undergoing a nystagmus. ठीक है, ठीक है, left eye nystagmus, right eye not moving, है ना, abduction was happening. ठीक है, left eye was not moving. हाँ, right eye left eye मत करो, don't think about right eye left eye, but one eye was moving and one eye was not moving. ठीक है, that is the correct. So correct answer is going to be internuclear ophthalmoplegia. Fourth option, I believe I have just now got, is the thyroid ophthalmopathy. Okay, That is thyroid eye disease or thyroid ophthalmopathy. Is that the fourth option? Please confirm that. Why not C? बेटा horizontal gaze palsy में अगर 1.5 syndrome होता है, okay, 1.5 syndrome में one eye is completely not moving, so it will not move this also. See here, focus here. See this 1.5 syndrome में one eye is totally not moving. See here, one eye, this eye is also moving, this eye is also moving. So it cannot be a horizontal gaze palsy. Horizontal gaze palsy is 1.5 syndrome, beta. 1.5 syndrome में both eye will not move. So one eye is totally not moving, other eye is half not moving. That is 1.5 syndrome, beta. So it is not horizontal gaze palsy. ना बेटा थायराइड भी नहीं हो सकता. ग्रेव्स ऑल्सो कैनॉट बी देयर. थायराइड इज ऑल ऑप्शन. गुड. हाँ डॉक्टर आशीष, रॉन्ग इमेज हो सकता है. सेंड मी दैट करेक्ट इमेज. ठीक है, आई एम राइटिंग माय नंबर हियर. ओके, सेंड मी द करेक्ट इमेज. इट मे बी राइट आई लेफ्ट आई ऑपोजिट, बट दिस इज द करेक्शन. ओके, ठीक है, चलिए मूव ऑन नेक्स्ट क्वेश्चन. Question number 3, type of RD seen in uncontrolled diabetes. We are all aware. Type of RD seen in uncontrolled diabetes is traction RD. Because of the vitreous hemorrhage, there is forms vitreous bands. This is a repeat question. This is absolutely same. Okay, correct है. A lot of people are saying image sahi hai. Some are saying image. हाँ, image doesn't matter. ठीक है, right left doesn't matter. Come to the next question. Traction RD, tractional. ठीक है, this is very simple question. Traction RD, easy peasy. Yes, this was easy peasy. Okay. Now there was a question of optic neuritis. I've not been able to get all the options. This one was 70% of patients present with optic neuritis. No, they don't present. ठीक है, optic neuritis will get 50% patient will get an attack of multiple sclerosis. Okay, sorry. So it is going to be 50% of multiple sclerosis patients will get an attack of optic neuritis. 50% patients of MS will get optic neuritis once in lifetime. So they do not present with this. That is a very high. Okay. Optic neuritis presents with normal fundus. Yes, it can happen. This is seen in retrobulbar neuritis. Okay, this can be seen. Okay, correct. Option number C and D I have not been able to gather. So it was, I believe there was. So one is treated with oral steroids. This is a wrong option. Treated with oral steroids, this is also wrong. So this is wrong. This is wrong. This is correct. As long as this is correct. Oral steroids directly are contraindicated. Okay, oral steroid, no, intravenous steroids are drug of choice, beta. Okay, intravenous is there. Okay, and yes, one was visual field and color defect correlate with the disease. No, they do not. Okay, not necessarily. Okay, so as of now, optic neuritis can present with the normal fundus or normal disc. Okay, that can be there. Okay, it can be there. Correct. Next question. Test done for all layers of retina. Proportionate, not necessarily proportionate to disease. Visual field and color vision defects are not always proportional. Okay, they can be more also, they can be less. Okay, oral steroids are definitely contraindicated. Next question, question number 5. Test done for all layers of retina is OCT. It was multiple choice, but I have not been able to gather all the choices, beta. ठीक है, multiple choices. We will discuss that. ठीक है, OCT, ये तो correct है. This was no options, no confusion regarding this question. Question number 6. Corneal transplant image was given. I believe there was an image in which they had shown a cornea with a graft inside, and they had given this image of corneal transplant, and they were asked about the storage medium and the sutures used. So storage medium is MK medium, and the suture is 10-0 monofilament nylon. That is correct. ठीक है. That is correct. Okay, this is the correct answer. MK medium vicral suture. No, it is not vicral suture. Moist chamber silk suture. It is not silk suture. It is not vicral suture. Okay, the correct answer is 10-0 monofilament. ठीक है, ये वाला है. अच्छा, रेटिना इन वीवो. रेटिना, हाँ, इन वीवो भी ठीक है. इन वीवो ओसीटी होता है. इट इज इन वीवो. ऑल ऑफ देम आर इन वीवो. देयर इज नो इन विट्रो. ऑल ऑफ देम आर इन वीवो. ठीक है, चलें. Okay, correct. Yes, this is all correct. And the last question was there, after cataract surgery, patient will flare cells after 2 weeks. What's the condition in which organism is responsible? Okay, endophthalmitis is the condition. And 2 weeks. See, 2 weeks is a time when you will get streptococcus. Propionibacterial acnes causes after 6 weeks. P. acnes causes after 6 weeks. Mucormycosis will be in immunocompromised. Mucormycosis will be in immunocompromised. And TAS is present within first 24 hours. Okay, toxic anti-shock syndrome presents within 24 hours. ठीक है, हाँ, staph या strep. Staph या strep. ठीक है, I believe there was a choice with strep. And no organism. अच्छा, ठीक है, I will delete this organism. ठीक है, but TAS presents within 24 hours. It was staph. Okay, good. So the staph, then it is absolutely correct. Then this is the correct answer. Okay, staph था. ठीक है, propione नहीं है. Propione is delayed onset. Propione is delayed onset. This we have done in our classes. ठीक है, correct. So these were the questions that were there. In case, was there any other question that you guys got? Please WhatsApp it to me on my number, or you can share it on the Cerebellum channel. Cephalococus was the option. Okay, thank you, thank you. Then that is absolutely correct. Then that is absolutely correct. No confusion regarding that. After 2 weeks, है ना? ठीक है. No 24 hours. It was after 2 weeks. ठीक है. Correct. So with this, I'll hand over the session to Dr. Amrit Nasta, sir. Thank you, Dr. Amrit. Thanks a lot, brother. I'm really obliged. Thanks.
Hello, guys. Hope you got a decent performance so far. So far, you've been listening, so I will not spend too much time. I know you must be tired. You went to report to the center early morning. So I'll quickly go through the surgery recalls, whichever I received, and you can let me know. There were, of course, a good number of surgery questions. Okay, and most of them, to my knowledge, are fairly accurate. Some questions were a little offbeat, but a lot of questions were very INI-CET standard. Like I put a reel yesterday. If you saw, you would have gotten one question straight away. Right? So let me know how it went. Not so hard, some question stuff, and I'll tell you what were the tricky ones. Not included in T4B breast. This is a repeat. Answer is going to be erythema more than 1/3. That is inflammatory breast cancer. That will be T4D. Correct. That will be T4D. This is a repeat question. What is not a contraindication for BCT? They are asked about BCT also. Prior chest radiation is, involved margin is, scleroderma, autoimmune is, limited to one quadrant is not. So best answer is going to be D. Right? Easy question. This came from my reel. Is or are, this was multiple correct statements about VAC. So reduces bacterial load is correct. Maximum pressure is 125 mm of Hg negative is correct. Promotes healing is correct. Reduces size of the wound is correct. So this had multiple correct choices and all correct. Okay, multiple correct choices and this was all correct. Right? Good. You are asking about this. Identify the procedure. See, even if you have not seen this procedure as an intern, it's okay. You can eliminate the other. No, they had given that they are removing some part of the incision. Some part of the incision they are removing. It is not IND. You know what is IND? It is incision and range of abscess. It was not a skin graft, because in skin graft, you know, you make those perforations and put the graft on the wound. It could not have been keloid excision because keloids are not excised. Okay, we don't excise keloids. So answer here is dog ear correction. This is a plastic surgery question. If the wound edges are unequal, a little part on the edge of the wound bulges, which you exercise. That is called dog ear, correct. Okay, IND and abscess drainage mean the same, na? Correct. So this was a dog ear correction. Yes. This is a repeat from last INI-CET. They had given polytrauma case, multiple injuries. What will you do? You basically had to follow the A, B, C, D sequence. This is a repeat, direct repeat from previous INI-CET. So this was secure airway, treat the tension pneumothorax. Some people said there was ICD. Okay. STSG is skin graft only, Sangya. And IV fluids, that is C for circulation, large bore IV lines. What students told me that, sir, two options at CT, so they could straight away eliminate those. CT could not be done first, CT is secondary survey. Right? So this was a repeat question. This was one question which I don't feel they should ask anymore. And the question may be a little different, but you should know how to calculate it. This, honestly, they should not have asked. I mean, come on, like nobody uses Alvarado anymore, but they always ask something ridiculous like this, so it's okay. Z flap is something else. That was another question. So in Alvarado, they had given scenario, woman has fever. Okay, fever gets 1 point, nausea gets 1 point, rebound tenderness gets 1 point, migratory pain gets 1 point. If there was tenderness, okay, I'm not sure if it was there. If there is tenderness, then that gets 2 points, but I'm not sure if tenderness was there or not. And raised TLC, of course, gets 2 points. TL get 2 points. So if the choices history is a little different, then answer changes. But as per this question, it becomes 6. Some students are saying 7, then the question changes. Okay, so this is how it is calculated. Okay, so if rebound tenderness was there, 1 point, nausea, vomiting, 1 point, fever, 1 point, migratory pain, 1 point, leukocytosis, 2 points. If it is like this, it is 6 points. If there was something else, if this option was there, tenderness in right lower quadrant or at the Mag-Burney point, then that gets 2 points and automatically it changes. Yeah. So this is a calculation, but honestly, I don't feel they should have asked this. This we have done in our classes. Which of these is incorrectly paired? So simple, achalasia. LA classification is not achalasia. LA is for GERD, even if you didn't know the others. Okay, LA is for GERD. Achalasia, Chicago, I always tell you, who, where, what, always know the city. So Chicago is achalasia. LA is GERD. So that was straight away. You don't even need to know the other. This was the incorrectly marked. Okay. Okay. This question you can help me with a little bit. With what is incorrect about tension pneumothorax? This may also be covered in medicine. That improper dressing of an open chest wound can lead to tension pneumothorax. Yes. Simple pneumothorax can never become tension pneumothorax. This is incorrect. Of course, simple can become tension if there is a flap leg wound. PEP, mechanical ventilation, can lead to tension pneumothorax is also correct. Fourth, I don't know the option. Okay, if you know, you can message me on Telegram the fourth choice. But students were like, sir, easy question thing. We didn't even need to think about this. Okay, thoracic spine fracture was one option. In what sense? Most commonly with PEP. Yeah, that's fine. That's possible. This was one Google question. Okay, this is the question which would smart students also may make a mistake in this, because they asked something very unique. They gave a history. Female presents with bleeding. A mass is felt 6 centimeters from anal verge. It is a intramucosal rectal carcinoma. What is the stage? They didn't ask the T stage. They said, what is the stage? Now, everybody will think mucosal means T1A. Most of you would have thought T1A. T1A would be stage 1. Most of you would have marked stage 1, but this is a googly question. Intramucosal, as per the staging over here, they have given this word, in situ or intramucosal, is stage 0. Okay, it is stage 0. So this was one of the googly questions where people may have gotten it wrong. I can understand this question. If you get wrong, don't feel bad. I mean, you could not have helped it. There was more history. Yes, I know it was an ulcerative lesion and things like that, but they had simply said it is an intramucosal carcinoma. So answer is going to be stage 0, not stage 1. Okay. Right. This is the question, the kind of question they put which you are not supposed to try. I mean, if you know it, fine. If you don't know it, you should let it be. Okay, then you should let it be, because students could not remember the image also. It was one of these two images. I believe what most students gave me is this image. Let me tell you, these surgeries, I am a bariatric surgeon, are not done in India very commonly. So for them to ask is just cruel. But okay, 2-3 cruel questions they always ask. This was one of them. So I feel, I always tell you, in surgery, see what is removed and what is joined. Stomach was removed, and if there was only one joining, if there is only one joining, answer is going to be SADI. SADI, SA stands for single anastomosis. Okay, which I believe was the image shown. If it is a single anastomosis, it is SADI. It stands for single anastomosis. So I believe this was the image. This is the answer. Fine. Honestly, barring sleeve, the other 3 are not commonly done. Okay, so answer here is SADI. This question was one, if you didn't have a clue, you could have left. Okay. Female cooking in kitchen had burns of face, upper limb, front of chest. So both upper limbs become 9 into 2. Easy question. Front of chest means upper chest or half of the torso. That again is 9%. So this is 27, and some amount of face also. So if face is also involved, face, the total head is 9%. So face would be maybe 4.5. So I would go for 27 to 30. Okay, 27 plus some amount of face. Okay, because full head is 9%. No, the whole head is 9%. So face would be 4.5%. This we have done in our class. Controversial question. Maybe even anatomy sir may also discuss it, but this we have done in our class. Hepatocystic triangle. It is the new Callat's triangle, which is not a boundary. It is cystic artery. Cystic artery is a content. In the OG Callat's triangle, cystic artery is the boundary. But in hepatocystic, the same I've put from the mission cut only. It is a cystic artery. The others are the boundaries. Okay, anatomy sir may also discuss this, because this is the reference from Bailey. This we have discussed in our class. This may be discussed in radiology. Patient with ureteric colic is being investigated. Investigation of choice, it is plain CT KOB. This is a repeat question. This came last time. Okay, it's a repeat question. This also we have done in plastic surgery. What is Z-plasty technique? It is a technique of scar lengthening. If you look at our images where I've shown you that lip flaps, Abbey flap, YV advancement flap, there is one Z-plasticky photo also. That is for scar lengthening, contracture release. Okay, so it is not a technique of flap creation. Huh? It's a local flap release. It's not any zigzag suturing. So it is for scar lengthening. Okay, this is again easy question. Colloid used as per Barclay and Moore, it is a albumin, right? Remember, Parkland's is crystalloid based ringer lactate. Colloid based Barclay's is albumin. Obviously, the others don't fit. No, it's not a rotation flap, Anjali. No, it's not a flap rotation. It is a transposition. This is also from our mission classes. Gangrene or critical limb ischemia occurs when ABPI, actually it is less than 0.4. That is the best answer. So answer here will be 0.3. Okay, it will be 0.3. It is less than 0.4. That is where you get gangrene, ulcer, critical limb ischemia. This is mixed pathology medicine surgery. Recurrent urinary stones occur in all except, but still easy question. Hyperoxaluria, oxalate stone, uricosuria, uric acid stone, calciuria, calcium oxalate stone. Citraluria does not cause renal stones, obviously. So citrates we give to prevent recurrent urinary stones. Okay, it is to prevent recurrent urinary stones. Others are obvious choices. So this was also a normal question. So these were the main surgery questions. There is one question I know Anand sir discussed. Okay, so I will leave it to him, leave it to his discussion that 6-week-old infant, non-bilious vomiting, non-projectile abdominal exam is normal. Bowel movements are normal. What is the diagnosis? I think he said infantile pyloric stenosis, but according to me, it should be GERD. But let him discuss this, let it be up to him because it is already covered in pediatrics. But my answer here would be GRD. In pyloric stenosis, there should be an olive mass, which is not seen. GRD can happen in this age group. There should be an olive mass. There should be visible peristalsis, which is not given. The vomiting should be projectile. Okay, it should be projectile vomiting. So my answer here would be GERD. Z is the way in which the flaps are made. It is the shape of the flap. Okay, right. And these were some other questions. They will be covered in the respective modalities, the respective faculties. Like these are all normal questions, like parathyroid imaging was sestami B, skull mets was follicular carcinoma. There was a mechanism of refeeding syndrome, H. pylori. So they all will be covered in the respective faculties. Right. So barring one or two questions, I feel the other questions were very normal. And if you would have just kept your calm, hopefully you would have tackled most of them. And now I will hand over to anesthesia. There was some questions from anesthesia. So let Dr. Janvi take over. Yeah. Thank you, guys.
Hello everyone, I hope that your exam went very well. And from anesthesia wise, I think you all as well as for me, it was very lucky because we had only one true question from anesthesia this time. So the question was that what is the reversal agent for vecuronium? And the options that we had were baclofen, then we had atropine, we had physostigmine, and we had neostigmine, correct? Now, a lot of students over here were like, ma'am, Sugama-Dex is not given. But remember, Sugama-Dex is a new agent against vecuronium and rocuronium for its reversal. And it is for its immediate reversal. Otherwise, for so many years, we were using the standard neostigmine for reversal of vecuronium. Okay, so what neostigmine does is that it will increase the acetylcholine at the acetylcholine receptors, and there will be displacement of the vecuronium, and as a result of this, the patient will be reversed from the neuromuscular blockade at the end of surgery. Okay. Now, because neostigmine also has effects other than at the neuromuscular junction, such as bradycardia at the heart, we give atropine along with neostigmine. Okay. But the main work at the neuromuscular junction is being done by the neostigmine. Acha, dantrolene was there in one of the options. Not physostigmine. All right. So anyways, we know dantrolene is the drug of choice for malignant hyperthermia. It has nothing to do here. So the answer was neostigmine. So that was the only question that I received. And of course, there was a question on barbiturates, but that will be covered in pharmacology. There was a question on pneumothorax and ventilatory settings. So that belongs to medicine. So it will be covered over there. Okay. All right. So there is some lumbar puncture question. If you guys want, you all can write it in the chat box and I will reply to you on the chat box over there. I have not received that question. So you guys can let me know and we will, I'll reply to you on the chat box on the LP question. All right. Thank you.
Okay, Mukta, hand over. Who is coming next? Please. Thank you.
Mukta ma'am, can I start?
Yes, ma'am.
Hello everyone, I am Dr. Devyani Puri and I will be taking the microbiology INI-CET recall. So I guess all the questions that came in micro, most of the questions are covered in the mission classes. There were a few questions that came a little bit twisted, but I think most of them were PYTs only. So starting with the first one, a very, very simple question, also one of the previous year topics, which is not a dimorphic fungus. I believe these were the options, and given the options, our answer is going to be Cryptococcus neoformans because all the other that we see are the dimorphic fungus, right? Then coming to question number 2, again, it's come previously so many times, and Trovis is a very, very, I think, favorite question for all INI-CET, NEET and FMG people because this question keeps coming again and again. So a child presented with intense perianal itching, mother sees thread-like worms in the perianal area. Then Scotch tape method was done, and this kind of a picture, I believe, was given. Is this the exact image? right? So this is kind of the image that was given. It is a D-shaped egg, also called as a plano-convex egg, right? And this is particularly seen in one organism, which is going to be your Enterobius vermicularis. This question comes every year. I don't know why they love this so much, but this question comes every year and it's a very, very direct question. Okay, moving on to question number 3. I guess till now, I think all the query is solved, right? Okay. Moving on to question number 3. This, I think, was the exact image which came in the question. You had this blood agar that was given and one streak of Staph aureus, and you had they had asked you what is the organism showing this kind of a picture. So this is actually satellitism, right? So that is actually satellitism, which is shown by one organism only, and that is going to be your Haemophilus influenza. I believe there is no doubt in this question at all. Right, there is no doubt at all. Okay, moving on to the next question. In this, you have to help me because I was getting two different questions from students. One was saying that ma'am, in this question doesn't tha question mein, and the other ones were saying ma'am does tha. So please help me in this question. If it was doesn't or if it was does, which protozoa doesn't have more than 2 morphological forms, or which protozoa does have? And was it like a multiple choice question or something? Please help me in this. So people are saying it doesn't have. Now people are saying does have. I am not sure. I mean, I think एक ही paper आया था, so I don't know why there are two different answers. Okay, a lot of people are now saying does have, does have, does have. So if it was does have and it was given like a multiple choice, then in this particular question, there is only one organism, which is going to be Trichomonas, that does not have 2 morphologies. Remember, there is no cystic stage. There is no cystic stage. There is only one trophozoid floating around, no cystic stage. So in this case, if it was does have, then Naegleria, Acanthamoeba, and Giardia, all 3 have. So my answer is going to be 1, 2, and 4. This is going to be my answer, right? So, okay, so maximum people are saying does, so I'm going to go with that. Okay, so my answer is going to be Naegleria, Acanthamoeba, Giardia, all 3 showing 2 morphological forms, right? Okay. Moving on to the next one. Again, one of the very mixed questions. I feel the options are incorrect or something like that, because they had asked which helminth causes auto-infection. And we all know the very famous mnemonic that is going to be the chest, right? In chest, there are 2 options that are given here. One is your H. nana, which causes auto-infection. And then there is another one, which is going to be your strongyloids. So can you please help me that if the, if it was any other option, or all both these options were given? If both these options were, okay, most commonly, if it was most commonly causing auto-infection, that I would go for strongyloids, right? Because H. nana most commonly doesn't cause auto-infection. It has your other ingestion of egg and everything. That is more common route for H. nana. Auto-infection is, yes, more common in strongyloids stercoralis. So if it was that, then I would definitely go for strongyloids stercoralis, right? Which is dependent on auto-infection for transmission. If this was the exact question, yes, again, I would go for strongyloids. Okay. Moving on to the next question. Again, one of the very, very direct questions have come so many times in your previous year questions. One, the Kanagawa phenomena in Vagatsuma agar is seen in which organism? Very specific to only one organism, which is going to be your Vibrio parahemolyticus, right? I hope everybody got this correct. Yeah. Major mechanism. Okay, we've moved on from this question and moved on to the next one. Kanagawa phenomena in Vagatsuma agar, seen in which? It is going to be seen in Vibrio parahemolyticus. Yes, everybody is giving me the correct answer. Okay, then I'm moving forward. This particular question has been already covered in PSM. I believe it is like an overlap question. It can come in micro or PSM. So then again, still covering it. Rocky Mountain spotted fever. This is done by your tick. Then endemic typhus is by flea, epidemic typhus is by louse, and rickettsial pox is by mite. So our answer here is going to be option number A. I believe this was like a multiple choice questions and you had to answer it, right? This was like a multiple choice question and you had to match the following. There were a lot of match the following and choose the correct options this time. Very, very unlike the INI-CET, it's like a different changed pattern. Option D was Clostridium. Okay, even if it was Clostridium, doesn't matter. I'm going to change it to Clostridium. Clostridium difficile. Okay, I'm going to change it to that. Love is epidemic. Okay. Chalo. Next, moving on to another, there was match the following like this. Somebody had given, only one person had given me this question that, ma'am, there was some match the following. I did not get the option number 3 and 4, but if it was this, then LX gel precipitation, I'm going to match with Corynebacterium, and Quelling's reaction was going to match with Streptococcus pneumoniae. Can anybody tell me, is there any other options? Okay, so if this is what this is the options, then I guess we have to just see for the next ones. For me, these two are going to match the following. Then identify the structure. Again, a very direct question. This is a dimeric structure, right? This is a dimeric structure with a J chain, and this is only seen in one, which is going to be your IgA. IgA is dimeric, whereas IgG and ME is monomeric, and IgM is pentameric, right? So that is going to be right. Okay, moving forward then. Again, another match of the following, again covered in PSM, but let's just go with the mnemonic. We know that north is for OT, right? South is for DOSA. So just going by that, southern blotting is for your DNA, northern blotting is for your RNA, western blotting is for the proteins, and eastern blotting for the enzymes. So just match the following like that. And this answer is going to be there. Okay. Moving on to the next one, in this you have to help me choose the true statements. I believe this was the question. In this, Vidal test is done in the first week of illness. It's a false statement because it is done in the second week. MAT is done for leptospira is true, and Wheel Felix is done in typhus fever is definitely true, and SAT is done in brucellosis is true. So these three statements are true. The only thing that I could not, this was the false statement. Again, if it was correct, choose the correct choices, I would go for B, C, and D. And if it was any other option, please add it to this. Okay. Okay, moving forward, this question came, there was a gram-negative diplococci organism. I don't know if the picture was given or not. Some people were saying a picture was given, some people were saying it was not given. Resistant to penicillin, and Neisseria kind of image was given. And treatment of choice they have asked. So yes, Neisseria gonorrhoeae can be resistant to penicillin. In that cases, the drug of choice becomes your ceftriaxone. I think this thing might be covered in pharmacology as well. But this is what was there. Okay, so the answer is going to be ceftriaxone. Moving on to the next one, there was a history of sexual contact, then a transient genital ulcer 2 months back, and now patient is presenting with these Palmer kind of pigmentation. Exactly this. So this is the manifestation of secondary syphilis, right? It is going to be for secondary syphilis. And if it is this, then our answer is going to be what? It is going to be serology. Serology is the best thing that we do for secondary syphilis. Okay, if it is an incorrect option, I will change it. Please text me the option later. But for now, okay, fourth option was gram staining, not biopsy. Okay. Okay, so our answer here is going to be serology, which we do for secondary syphilis. We don't do biopsy grams. We don't do gram staining, KOH, or Zank smear for this, right? Moving on to the next question, there was a history of recurrent painful vesicular genital ulcer. So mind you, every time you hear the word painful and vesicular genital ulcer, you always have to think about your herpes simplex virus. Then biopsy was done and they're asking you the drug of choice. So drug of choice to treat these herpes infection is going to be your acyclovir, right? It is going to be your acyclovir. No, it is not Zank smear. Zank smear is very, very specific to herpes. In the previous question, some people are saying it's Zank. It is very specific to herpes simplex virus, not for syphilis. Hence, serology is the answer there. Okay, acyclovir, we are done with that. Then there was one question. This was one of the different questions that had come, has not come previously, but they asked you which of the following methods is most appropriate to identify different strains of the same species of the Mycobacterium tuberculosis. So in this question, the answer is going to be multiple interspace repetitive unit typing. This is the kind of typing that we do when we want to identify the different strains in the same species, right, of any organism, not just particularly Mycobacterium tuberculosis, but for other organisms as well. So it is going to be multiple interspace repetitive unit typing. This is one of the googly questions that came, has not come previously. But yes, this is going to be the answer. Moving on to the next question, already covered by, I think, Vivek sir. So high-risk groups of HIV positivity, except again, long-distance truck drivers are the one. Sir has already spoken how they are the bridge people, right? So they are the bridge between all of these people. So they are not going to be the high-risk groups. Okay. Moving on to question number 17, we had an HIV positive patient presenting with dysphagia and odynophagia, and esophagus showed some kind of plaques. And what is the most likely organism? So considering that this is an HIV patient, that means it is an immunocompromised patient, and having some kind of plaques on the esophagus, I was not sure if these are the options. Can anybody tell me if... Okay, it was multiple choice for MTB. Okay, I will just write it here, multiple choice. So it is not the most appropriate. This might not be the question. Okay. Okay, I'll change the question 15 to multiple corrects. With plaque, yes, if this is the question, I think I would definitely go for some kind of a candida species isolation causing esophageal candidiasis. So I would go for budding yeast cells with pseudohyphae. That is going to be my answer, right? Okay. Moving on to the next one. This has also been covered. Cervical carcinoma. I think HPV serotypes associated with cervical carcinoma, the most common types. So type 16 and 18 is going to be the one that is going to be causing cervical carcinoma. That was, I think, the question. Okay. Finally, some miscellaneous questions. I got a few students writing something about pseudomembranous colitis and something about the RT-PCR and toxoplasmosis infective stage. If you have any of these questions, right, if there are any of these, please this is my phone number. Just please message me if there are any of these questions regarding these miscellaneous questions that I got, or you have any other recall also, right? Okay. So I think, thank you. And microbiology is done. I think I can hand over to the next person. I think it's Dr. Rena will be taking it.
Yeah. Hi, how are you?
Hello, ma'am. I'll just stop sharing.
Yeah, sure. I'll just share my screen. Okay, so hi everyone. I hope OBG was easy for everyone. So not many questions from Obs and Gynae.
Hello, ma'am.
Yeah.
This is Dr. Govind.
Yes, sir. Hi, sir.
Ma'am, can you give me 10 minutes?
Oh, sir. Aap kar
Because
lijiye.
I have to leave actually.
Yes, sir. No problem.
Yeah. Thank you so much, ma'am.
Okay, sir.
So, hello everyone, this is Dr. Govind. So we can discuss the pharmacology questions. So I hope I have got most of the questions. So starting with the first question. So there's a question in which phenoldopam was given, and the question asked was, what is the mechanism of phenoldopam? Am I audible? Yes, phenoldopam mechanism. Phenoldopam, we all know, is a D1 agonism. By D1 agonistic action cause vasodilation and improve the renal perfusion. So answer is D1 agonism. Clear? Next question. It is on gonorrhea. So gram-negative diplococci resistant to penicillins was asked. What is the treatment? So the drug of choice is ceftriaxone. Ceftriaxone is a drug of choice for gonorrhea, which is resistant to penicillins. Next question was a newborn baby, 4-month-old infant, and with scabies. So which drugs are safe? Yeah. So two drugs, drug of choice is permethrin, 5% cream, which is drug of choice. And second drug, which can be safely used in newborn babies, are crotamitol. Crotamitol. Yeah. So crotamitol and permethrin. So 1 and 3, that will be the answer. Okay. The next question was different schedules of drugs, and luckily only one schedule X, because we usually study schedule H and schedule X only. Schedule X are for addictive drugs. So only one option was there which was matching with the addictive drug morphine. So 3-1 is the only one option. C is 1. So rest you can make accordingly. So hepatitis B jo hai, that is schedule G drug, whereas veterinary drugs are schedule Z drugs, and insulin will come in schedule H drugs. Yeah? So only this is the combination. If you have seen morphine, you could have answered this question. Clear? Next, which is false regarding thalidomide? Thalidomide में गलत क्या है? Thalidomide teratogenic, we all know. Thalidomide is a drug of choice, for not drug of choice, is commonly used for type 2 lepra reaction, and it is used for relapsing remitting multiple myeloma also, not multiple sclerosis, multiple myeloma. So all three are correct. It is anti-metabolite is wrong. It is an immunosuppressant drug which acts by decreasing many interleukins. So anti-metabolite is wrong. So this is the answer here. Okay. Next, which is associated with cholestasis without portal inflammation. Yeah. So normally most of the drugs which cause toxicity, they are causing the inflammation in the portal veins also, portal area also. So acetaminophen cause hepatic necrosis with portal inflammation. Same with amoxiclav, isoniazid also cause same. But the natural hormones like estrogen, androgen, they do not cause inflammation. They only cause cholestasis without portal inflammation. Without, कुछ है? Answer among these options are is only estrogen plus androgen. ये मल्टीपल करेक्ट था? Is it multiple correct? तो विदाउट नहीं पूछा होगा, विद पूछा होगा. अगर मल्टीपल करेक्ट है तो वी नीड टू सी इसमें विदाउट नहीं होगा, बिकॉज ओनली वन इज विदाउट, दैट इज एस्ट्रोजन प्रोजेस्टेरोन, एस्ट्रोजन एंड्रोजन कॉम्बिनेशन. ओके, चलिए नेक्स्ट क्वेश्चन. विच इज यूज्ड फॉर क्लिनिकल क्योर ऑफ मलेरिया? क्लिनिकल क्योर ऑफ मलेरिया, दैट मीन्स फॉर ट्रीटमेंट ऑफ मलेरिया. रिमेंबर, प्राइमाक्विन इज नॉट यूज्ड फॉर ट्रीटमेंट. अदर 3 ड्रग्स आर यूज्ड फॉर ट्रीटमेंट. सो आंसर इज 1, 2 एंड 3. आर्टिमिथर भी यूज करते हैं, सल्फाडॉक्सीबाइमेथामिन, क्लोरोक्विन भी यूज करते हैं. क्लियर? चलिए, थैलिडोमाइड वाले में मल्टीपल थे, तो थैलिडोमाइड में मल्टीपल थे या थैलिडोमाइड, उसमें फिर ट्रू पूछा होगा. ट्रू पूछा होगा तो मेक इट अपोजिट. इफ इट इज ट्रू आस्क्ड देन मेक इट अपोजिट. ओके, चलो नेक्स्ट. एरिथ्रोपोएटिन इज प्राइमरली यूज्ड फॉर विच टाइप ऑफ अनीमिया? एरिथ्रोपोएटिन वी नो क्रॉनिक किडनी डिजीज यूज तो करेंगे सीकेडी में तो देंगे, ठीक है. प्लस सेकंड, एरिथ्रोपोएटिन इज आल्सो यूज्ड फॉर माइलोडिस्प्लास्टिक सिंड्रोम और एंटी कैंसर ड्रग्स आल्सो. माइलोडिस्प्लास्टिक एंड एंटी कैंसर वाले में भी यूज करते हैं. सो करेक्ट आंसर इज 2 and 3 है. 2 and 3. क्लियर? चलिए नेक्स्ट. लोडिंग डोज कैसे? ओरल ड्रग्स की लोडिंग डोज का क्या फॉर्मूला होता है? वीडी इंटू टारगेट प्लाज्मा कंसंट्रेशन and divided by percentage bioavailability. Okay, so volume of distribution, plasma concentration, bioavailability. So 1, 3 and 4 are used. Half life is not used. Half life is not used. Okay, half life is not used. Thalidomide question multiple answer sir. ठीक है, we will see that. But a myelofibrosis या myelodysplastic syndrome similar सी condition है. Wherever bone marrow suppression is used, we can use erythropoietin. एमडीएस नहीं होगा, माइलोफाइब्रोसिस होगा, और एंटी कैंसर ड्रग होगा, समथिंग लाइक दैट, और माइलोफाइब्रोसिस होगा. ठीक है. सो बेसिकली व्हेनेवर देयर इज बोन मैरो सप्रेशन वी कैन यूज. ठीक है, चलो. विच इज नॉट यूज्ड इन मैनेजमेंट ऑफ पीपीएच, ये मैम भी शायद डिस्कस करेंगे. डाइनोप्रोस्टोन इज द आंसर. डाइनोप्रोस्टोन इज द आंसर. ऑक्सीटोसिन, मिथाइल एर्गोमेटिन, मिसोप्रोस्टोल वी कैन यूज. प्रीवियस मल्टीपल करेक्ट आंसर वाज आस्क्ड सर. किसका मल्टीपल करेक्ट ही तो बताया बड़ा. चलिए, देन व्हाट इज ट्रू रिगार्डिंग इमिप्रामिन एंड डाइफेनहाइड्रामिन? Remember, imipramine is TCA which inhibit the reuptake of serotonin, and diphenhydramine is H1 blocker, antihistaminic. They do not have direct interaction with each other, but imipramine has very strong anticholinergic activity as well as diphenhydramine is first generation antihistaminic. It also has strong anticholinergic activity. So answer is both block muscarinic receptors. Both block muscarinic receptors. There was no CKD and MDS option, sir. Milo 5. We will discuss that question. I will collect more data on that question and then we will change accordingly. Okay? Chalo. Most teratogenic strongly associated with neural tube defect and avoided in pregnancy. सबसे strong valproic acid है. You will know valproic acid is contraindicated in pregnancy. Okay. मैंने PGF2 अल्फा लिखा था इसमें, तो लोग कह रहे हैं कि मिथाइल अर्गोमेट्रिन दिया था, तो देयर मे बी कार्बोप्रोस्ट हेयर. कार्बोप्रोस्ट हो सकता है, तो आंसर तो डाइनोप्रोस्ट नहीं आएगा और ऑप्शन कुछ भी लिखा हो. ठीक है, चलो नेक्स्ट. पेशेंट ऑफ कंजेस्टिव हार्ट फेलियर के सिम्टम्स है. कंजेस्टिव हार्ट फेलियर है तो वी हैव व्हाट वी विल डू, वी विल गिव बेसिकली लूप डायूरेटिक प्लस SGLT2 इनहिबिटर to manage symptoms and improve long term outcomes. Loop diuretic plus SGLT2 inhibitors. Loop diuretic plus SGLT2 inhibitors. ठीक है, चलिए नेक्स्ट क्वेश्चन. कॉम्प्लिकेटेड यूटीआई में क्या देंगे? कॉम्प्लिकेटेड यूटीआई सेफ्ट्रायोक्सोन विल बी प्रेफर्ड अमंग देम. सेफ्ट्रायोक्सोन देंगे. मीरोपेनम इज यूजली फॉर रेजिस्टेंट केसेस. अगर रेजिस्टेंट मेंशन हो तभी देते हैं. अमोक्सिक्लैव कॉम्प्लिकेटेड में देते नहीं, दैट इज नॉट इफेक्टिव. नाइट्रोफेंटाइन इज ओरल ड्रग नॉट यूज्ड. इंजेक्टेबल देना था, सो आंसर विल बी सेफ्ट्रायोक्सोन है. पीजी अल्फा ही ऑप्शन था. ठीक है बेटा, PGF2 अल्फा भी यूज कर सकते हैं, कार्बोप्रोस तो देते ही है ना. चलिए नेक्स्ट क्वेश्चन. दिस इज अ क्वेश्चन इन विच देयर इज बेसिकली हाई शॉक है, यूरिन आउटपुट लो है. Shock and low urine output. So which drug we will give? So we will give norepinephrine. Septic shock है basically. Septic shock we will give norepinephrine. Norepinephrine is drug of choice. Septic shock में noradrenaline is drug of choice. Bempedoic acid के बारे में क्या false है? What is false? Non-competitive inhibitor is wrong. It is a competitive inhibitor of ATP citrate-lyase. Dicarboxylic acid chemical structure है. Inhibit de novo cholesterol. Yes, cholesterol formation में कम कर रहा है. And can be used with statins. Yes. So non-competitive is wrong. It is competitive. It is not competitive. And non-competitive नहीं है, competitive है. Clear? Competitive है. चलिए नेक्स्ट. अक्यूट मेनिया में क्या कौन सी दवाई यूज करते हैं? अक्यूट मेनिया, रिमेंबर एमिट्रिप्टाइलिन इज TCA. It is not used in acute mania. Haloperidol like antipsychotics can be used. Valproate can be used. Lithium can be used. So answer will be 1, 2 and 3. 1, 2 and 3. Multiple question. Clear? Previous question multiple answer sir. इसका तो ट्रू पूछा होगा तो मल्टीपल बना दो इसको यार. अगर ट्रू पूछा तो मल्टीपल बना दो. आई होप द ऑप्शंस आर सेम ना. ऑप्शन तो यही थे. क्लियर? चलिए नेक्स्ट. इंटरेक्शन बिटवीन कार्बामाजेपिन एंड एरिथ्रोमाइसिन. कार्बामाजेपिन ले रहा था, आफ्टर स्टार्टिंग एरिथ्रोमाइसिन डेवलप्ड डिजीनेस, डिप्लोपिया, एटेक्सिया, कंफ्यूजन, ये सब हो गया. So basically these are carbamazepine toxicity. Why carbamazepine toxicity occur? Because erythromycin inhibit the metabolism that lead to carbamazepine toxicity. Okay? Fluids are given already. Hello lithium valproate. नहीं सर, सही है क्वेश्चन. हाँ डे सही है क्वेश्चन, मेरे को पता, मैंने काफी मेहनत करी है भाई. ठीक है, चलिए नेक्स्ट क्वेश्चन. व्हाट इज रोल ऑफ फेज 1? फेज 1 का क्या रोल है? It is to introduce or expose the functional group for further metabolism. Phase 1 make the drug sticky. Phase 1 make the drug sticky and that will lead to phase 2 metabolism. सर हाइपर सेंसिटिविटी, बेटा इसमें हाइपर सेंसिटिविटी तो अकेले कार्बामाजेपिन से भी होती ना. हाइपर सेंसिटिविटी तो सिर्फ कार्बामाजेपिन से भी होती है ना. चलिए नेक्स्ट. Which is used to reverse the muscle relaxation caused by weak coronium? तो आंसर इज नियोस्टिग्मिन. आई होप ये डायरेक्ट क्वेश्चन था, इसमें कुछ पंगा नहीं था. दिस वाज द डायरेक्ट क्वेश्चन. एनी प्रॉब्लम इन दिस क्वेश्चन? यस नो, जल्दी से बता दो. इट सेड एरिथ्रोपोएटिन विल इंप्रूव एनीमिया इन व्हाट कंडीशन? ठीक है, वो तो पुराना हो गया बेटा, ये बताओ. फ्लूइड रिफ्रैक्टरी शॉक में बेटा आइनोट्रोपिक तो कोई भी दे सकते हैं ना, डोपामिन क्यों देंगे? नॉरएपिनेफ्रिन इज द प्रेफर्ड आइनोट्रोपिक। यस, ये डायरेक्ट क्वेश्चन था, नियोस्टिगमिन इज द आंसर। ठीक है, चलिए नेक्स्ट क्वेश्चन, बार्बिट्यूरेट बेंजोडाइजेपिन में विच इज करेक्ट? आई होप दीज आर दी ऑप्शंस। मेरे को इसमें डायरेक्ट ऑप्शंस क्लियर कट नहीं मिली, दो ऑप्शंस मिली थी, टू आई हैव मेड माई सेल्फ। बोथ एक्ट ऑन गाबा क्लोराइड चैनल, दिस इज राइट। Flumazenil is antagonist of barbiturate is wrong. Flumazenil is antagonist of benzodiazepine. Benzodiazepine increase the duration, not they increase the frequency, not duration. And barbiturates used to treat acute anxiety. No, benzodiazepines are used to treat anxiety. किसमें सक्सिनल कोलिन की जगह बेंजोडाइजेपिन? डेंड्रोल। अच्छा, इसमें डेंट्रोलिन था। ओके, सक्सिनल कोलिन की जगह डेंट्रोलिन था, डेंट्रोलिन। ये मल्टीपल चॉइस था, दिस वाज आल्सो मल्टीपल चॉइस। मसल रिलैक्सेशन वाला मल्टीपल चॉइस था या ये था बार्बिट्यूरेट वाला? अच्छा, it was multiple choice. Okay, so we will see the multiple choice. Can you tell me the options? Incorrect was asked. Okay, can you tell me the options? Mostly यही options थे। अल्कोहल विड्रॉल इन फ्लूमाजेनिल। ओके, फ्लूमाजेनिल अल्कोहल विड्रॉल था। ठीक है, so I will make a question and post. थर्ड एंड फोर्थ ऑप्शन गलत हैं। टेल मी व्हाट आर द ऑप्शंस। बोथ एक्ट ऑन गाबाई, बोथ एक्ट ऑन गाबाई। ठीक है, चलो आई विल डिस्कस विद यू पीपल एंड मेक द क्वेश्चन। चलिए, so these were the questions I have got. If you have any other pharma question, please let me know. You have last 1 minute to tell. Wrong was asked. ठीक है बेटा, wrong was asked, I have written. Incorrect was asked. अल्कोहल के साथ बेंजोडाइजेपिन, I've got it. बेटा ड्रग ऑफ चॉइस फॉर सेप्टिक शॉक इज नॉरएड्रेनालिन। वेसोप्रेसिन क्यों नहीं है? वो क्यों नहीं है? क्योंकि ड्रग ऑफ चॉइस भैया सबसे ज्यादा इफेक्टिव भैया, तो नॉरएड्रेनालिन इज ड्रग ऑफ चॉइस। ठीक है, बोथ एक्ट ऑन गाबा वाज वन ऑप्शन, आई करेक्टेड इट। एनी अदर क्वेश्चन, एनीवन रिमेंबर? यूटीआई पेशेंट विद हाइपोटेंशन, उसमें तो सेफ्ट्राइक्सोन ही था ना ऑप्शन। बेटा एरिथ्रोमाइसिन टॉक्सिसिटी के फीचर्स नहीं है, फीचर्स वर ऑफ कार्बामाजिपिन टॉक्सिसिटी। जो एटेक्सिया वगैरह है, दैट इज कॉज्ड बाय एंटी एपिलेप्टिक ड्रग्स इन ओवरडोज। बेटा वो टॉलरेंस वाला मेरे ख्याल से आई थिंक उसका था, फोरेंसिक का क्वेश्चन था, सर विल डिस्कस। ओके, चलो आई थिंक आई हैव टेकन टू मच टाइम फ्रॉम द मैम। इफ यू आर नॉट एबल टू रिमेंबर एनी अदर ऑप्शन, कैन आई बी नॉट कुछ लिख रहे हैं, आई विल ऐड दैट आल्सो। ठीक है, आई विल डिस्कस विद टू पीपल। ठीक है, चलिए, ऑल द बेस्ट एंड नाउ द माइक विल बी गिवन टू डॉक्टर रैना। थैंक यू मैम, थैंक यू सो मच फॉर गिविंग मी टाइम।
Thank you, sir. No worries at all, sir.
Please, stage is all yours.
Thank you. So I'll just share my screen and then we can start. Okay, so hi everyone, and I know you're all very tired, and I think a lot of OBG has been covered already as other subjects. So let's quickly go through what was particular to OBG. I'll skip the other ones very quickly. So there was a question on, there were two questions on MTP. The first one was opinion of 2 doctors is required as per the new Amendment Act for a period of gestation of what? So we all know that less than 20 weeks, it is 1 doctor, and 20 to 24 weeks, we require the opinion of 2 doctors. Again, this is a very commonly asked area. MTP is asked again and again. The other question, which was straight for, the question was just one line, the minimum age for an MTP is what? And since nothing else was mentioned, the safest answer to mark is 18 years. And why 18 years is the safest to ask? Because nothing, so if it would be better if they had asked consent or they'd use the word legal, But since nothing is mentioned, we all know that 18 years, the woman should be, if she's less than 18, she should have a legal guardian, and it comes under the POCSO Act. So the safest option to ask is 18, although yes, there is no lower limit, because if she has a legal guardian and if the indications are met, anyone can get an MTP. Now, the next question, according to modified Rotterdam criteria, what are the criteria for PCOS? And I told you PCOS is a favorite of the INI-CET exam, and I also told you why. PCOS expected Thalitha question. And we know Rotterdam criteria, according to this, there would be delayed menstruation, there would be clinical or biochemical hyperandrogenic features. So 2 and 3 is definitely there, plus the polycystic morphology, right? Obesity is not a criteria. Insulin resistance is not a criteria. Okay. The next question was, which of the following does not cause fetal bradycardia? Again, a very straightforward question. Abruption, we know, causes fetal distress. Fetal distress can present as fetal bradycardia. Fetal head compression can cause fetal decelerations. It usually causes early decelerations, but the fetal heart does drop. Meconium aspiration, fetal distress, again, bradycardia. Maternal fever is going to cause tachycardia, and hence it's going to be maternal tachycardia will cause fetal tachycardia. Okay, so I'll just see what's all on the chat box also. Okay, we'll come to each question, don't worry. Other questions also coming in between. If legal was mentioned, Spirey, then definitely 18 years. Otherwise, also safely 18 years, you can easily mark. Next question, the uterine stimulant, this also is already discussed, right? We all know dinoprostone, that is PGE2, is used for cervical ripening or induction of labor. It is not used for PPH. The other prostaglandins, misoprostol and 15-methyl analog of PGF2 alpha. Sorry, this is PGF2 alpha, carboprost is used. Okay. Congenital heart failure was an option here. Okay, here. So I think meconium was not there, right? Congenital heart disease or heart block was there. Congenital heart disease. Okay, got it. Okay. Now this is that laparoscopy question which a lot of people are discussing. What was this? So the question that I got was that this is the laparoscopic image of a patient with infertility and delayed cycles with no tubal block. That means tubal, the tubes were patent. What is the probable diagnosis? Now remember, and I think bulky ovaries was mentioned in the question. Bulky ovaries was mentioned, and you can see also the ovaries are bulky. Okay, ovarian cyst was an option. This was not there probably. It was multiple choice. Okay, it was multiple choice. So here the answer is PCOS. Why is it PCOS? Because whenever you have these big looking ovaries without a well-defined cyst, both the ovaries are enlarged, there is infertility, there's delayed cycles, this is going to be PCOS. Okay, ovarian cyst was an option. I'm cutting out tube ovarian mass, this one is an option. Enlarged ovaries were there. They had mentioned normal uterus. Okay, they had mentioned normal uterus and tubes were patent. Okay, fibroid was not there. Okay. Fibroid nahi hai, theek hai. Bulky ovaries, it was bilateral. So this is PCOS and it is a single question. It's not a multiple question. Okay, so this is very clear cut. And again, as I said, PCOS is a favorite of the INI. So this is again quite straightforward. Endometriosis, you'll see chocolate cyst, or you'll see the ovaries stuck to the back side of the uterus, kissing ovaries. Okay, fibroid is not there. Okay, got it. Fibroid nahi hai, theek hai. A 50-year-old patient presents with an ovarian mass with ascites and omental caking. Ultrasound reveals solid components and the CA-125 was raised. Okay, so what is this? We know it's an ovarian tumor, and the most common tumor to present this way is a serous cyst adenocarcinoma. The CA-125 is going to be raised, solid components are going to be there, omental deposits will cause omental caking, and ascites will be there. Okay. Dispellage present. Okay, PCOS. Yes, it is PCOS. PCOS will be there. Okay, why not ovarian cyst? Because that's not how an ovarian cyst looks like, NEET PG. It is, ovarian cyst will be very well defined. You can easily make out. Both the ovaries uniformly enlarged will be PCOS. Okay, this was 65 years. All right. Okay, and this was multilocular. All right. So CA125 is the biggest clue here. Omental caking, ascites also are very big clues. So this is serous cystadenocarcinoma. Now there's a question on there was a tumor given and there were this histopathology given. These are called exner bodies or coffee bean nucleus. One of the thing was given. And then asked which of the statements are true. So this is a granulosa cell tumor. It is a sex cord stromal tumor. Inhibin is increased. CA125 is not increased. And call extra bodies are seen on the histopathology. Was this the question or was it something else? It was an image question. Were both the gross and histopathology given? Coffee bean was given. That this was not the histo. Okay, so some people did tell me the coffee bean nucleus picture was given. Okay, so coffee bean was given, not call Exner. Chandan, elderly people can also have PCOS. It doesn't have to be young. PCOS can happen at any age. Okay. Okay, this is fine. Okay, all right. Next question. All are users of magnesium sulfate except or I think this was a multiple choice question. It was not except also, I think, right? So multiple choice question. Remember, magnesium sulfate is used for neuroprotection of the fetus, and it is also used for prevention of seizures. We give it for both prevention and treatment of eclampsia, right? It doesn't increase renal perfusion, right? It, in fact, has nothing to do with the kidney. Why we look for urine output is because magnesium is excreted through the kidney. So if the kidneys are getting conked off because of preeclampsia, eclampsia, magnesium toxicity will happen. That's why we look for urine output. So it is just excreted through the kidneys, nothing else. And there was one more option. What was the last option? I think it was prevention of abruption, but I'm not sure. Was the last option prevention of abruption? So if this was an option, this is also true to some extent. We don't give it to prevent abruption per se, but yes, studies have found that abruption can be prevented by giving magnesium sulfate. So this would also be correct. The only wrong one will be increased renal perfusion is wrong. Okay. So this was an exception wala question or this was a multiple option correct question? Okay, sorry, there's a bit of a lag. That's why it's taking some time to see this. Wrong pucha tha, so it was not multiple choice. Okay, next question. The next question was an asymptomatic 29-year-old. I need help in this question also. 29 pregnant woman presents in the first trimester with urine culture showing E. coli. The most common complication associated with this. So this was a question on asymptomatic bacteriuria. And what I understand is that pyelonephritis was not an option because asymptomatic bacteriuria, we should note that in 25% of patients, it can cause pyelonephritis. Sorry, it can cause pyelonephritis. And this can lead to the most common complication is preterm, right? So chorioamnionitis is not there, okay? It was a single choice question, okay, all except. Okay, it can causes all, this is all except incorrect. So chorioamnionitis would be the incorrect option then. Okay, E. coli more than 10 to the power 5, that means significant bacteriuria, asymptomatic significant bacteriuria. Okay. And they had asked the most common complication they had asked, or which is not correct, they had asked. Okay, miscarriage was an option. Okay, so the best answer would be what does it cause? It causes preterm labor. Okay, chorioamnionitis is caused when there is PROM or PPROM. Right, correct. So preterm would be the best answer here. Which of the following is not seen in Turner syndrome? So this is again a repeat question. Many people would have discussed this. A prominent occiput is not seen. Nothing came from primary amenorrhea, but remember Turner's is the most common cause of primary amenorrhea and hence Turner's is very commonly asked in the exam. HPV strain we've already covered 16, 18, so not spending time here. Most teratogenic drug causing neural tube defect already discussed. This is sodium valproate, not spending further time here. All are examples of aneuploidies except, so Bloom syndrome is a mutation. Bloom syndrome is not aneuploidy. Trisomy 21, 13 and Klinefelters are all aneuploidies. The next question was arrange in correct sequence. Okay, so some of you had got stuck on this question. Arrange in correct sequence the steps of taking a pap smear. Okay, so remember when we take a pap smear, I don't know if the question was given like this or if the question was given, the 4 things were given and that you had to put them in order. If it was given like this, remember, first of all, remember when you take a pap smear, okay, a PV is not usually done. In fact, it's never done, because if you do a PV, you are contaminating, you're touching the cervix. You don't want anything to contaminate the cervix. So no douching. The patient is not supposed to use any pessary, vaginal pessary. You're not supposed to do a PV. These are the rules when you do a take a pap smear. So just to put them in order, it was not like this then. So if you have to put them in order, then you put the patient in lithotomy. Actually, you can put the patient in a dorsal position also. Then put in a speculum, then take the smear, and then you do a PV. Okay, that will complete the examination. So PV is never done before taking the smear. That is the rule that is important to remember. Okay, so it was put in order, and these were the steps, right? Okay. Then timing of insertion of IUD for good acceptance. This was multiple choice correct. This was also fairly easy, just the language I think confused some of you. So immediate postpartum, that is PPIUCD, within 10 minutes you can put. Within 48 hours of delivery, this is early postpartum. Again, you can put within 5 to 7 days of menses. That means post-menstrual. Post-menstrual you can put. And within 5 to 7 days of the next menstrual cycle basically meant premenstrual. Okay, this you will not prefer not to put. Okay, so basically you can put in a copper T anytime as long as you're reasonably certain the patient is not pregnant. But we usually put it post-menstrual. We prefer not to put it premenstrual because the patient might actually be pregnant. So A, B, and C are the correct options. Okay, which is contraindicated in pregnancy. This was also a question I think radiology will be discussed over, but we all know CT scan has very high ionizing radiation. So this is not used in pregnancy. Ultrasound, MRI, and Doppler can safely be used. So this was from my side, OBG, and it was quite straightforward. If anything I have missed, please let me know. I'll just go through the charts now. PV was not given in order. Okay, speculum was there, lithotomy, speculum, eye spatula for sample collection. That's how it was given and order was asked. Okay. PV was not given in the sequence. Order with option of all PV was excluded in one option. So you have to choose the option where PV was excluded. PV is not part of pap smear, but if you had to include PV, it's the last step. Okay. Any question I've missed, please let me know. Okay. Put on the chat box. You all have my numbers. You can drop me a message. And I think OBG was fairly on the easier side. So all the best for your result. And I will now pass over to the next faculty. I'm not too sure who's there. Yeah, hi, sir. Good
Hello.
evening.
Good evening, ma'am. Good evening. Thank you, ma'am. So, hello, dear students. Hope audio, video, everything is okay. Yes. Please inform me that everything is good. This screen is blurred. Yes. Hello, everybody. Hello. I think screen is okay.
No, sir, PPT is blur.
PPT is blur. Okay. Yeah. Still just blur. Okay, dear students, there is a little technical issue, but I will discuss orally. I will discuss orally. I will not take too much time. I don't know why the screen is blur. Okay, so we are continuing. I'm speaking the questions. Okay, so this is the recall based question. I don't know, just I'm trying for once. Hope your exam was well. Okay, So sorry, there is a little technical issue that there is the screen is blur, but hope you all did nice in your exam. So just I'm speaking the questions. Okay. Yes, I'm trying once again. Sorry, dear students, I will share this PDF in the Telegram group. You all will get. Okay, don't worry. So the first question about our sacrum, over the sacrum. So there was the image over the dorsal view of the sacrum, and they asked about the action of the muscle marked. So if you will see the sacrum on the posterior side, near the dorsal, near the lower side, there is the attachment of the gluteus maximus. So they ask about the gluteus maximus. 4 options we are given. Okay, first was the medial rotation of the hip, second was extension at the hip, next was the abduction of the hip, and next was the flexion at the knee. So always I was saying one question from the gluteal region, they asked this time the gluteus maximus muscle. Okay, and what is the action? I told you the gluteus maximus is responsible for the extension at the hip. Okay, yes. I will share. Sorry, technical issues there. Okay, I don't want to delay the session also, so screen is blurred. Sorry for that. ओके जस्ट
सर एक बार वीडियो को आपने वीडियो ब्लर किया हुआ है, पीछे का बैकग्राउंड, उसको एक बार
ये कहाँ से होगा फिर?
सर वीडियो को जो ऑप्शन आता है ना सर, ऑडियो वीडियो ऑन करते हैं, लेफ्ट में बॉटम में होगा सर।
अच्छा ओके,
जूम पे
ना? अच्छा ओके, ये मैं जूम में गया और वीडियो में गया। अच्छा ओके
यस, इज विजिबल।
थैंक यू शुभम, थैंक यू सो मच भाई, थैंक यू। So, dear students, again, thanks to technical team. Okay, so I want to say that this is the recall based question, and the question and options may be little different. Okay, but even whatever the correction, please inform me. Okay, so there was the question, first question, what is the action of the muscle marked with the arrow in image? So there was the option about our medial rotation of the hip, extension at the hip. I think I'm going to spend one. Just few seconds. Okay, so hope it is visible. These are the option. Answer was the arrow was marked over the our gluteus maximus muscle. Yes, arrow was marked over the our gluteus maximus muscle. Okay, so here was the point. So answer was the gluteus maximus. Gluteal region is important. And what is the action of the gluteus maximus? I told you that action is the our extension at the hip, and it is responsible for the if there is the paralysis. In case of the Duchenne muscular dystrophy, then you say, sir, this is the positive Gore sign. Are you getting this point? Okay. So this is our, the extension at the hip. Please inform me if any correction is needed. Okay. Yes, Harshita, Vinayak, abduction of the hip. Remember, if gluteus medius minimus are pointed, then abduction of the hip. Okay. Yes. Now try to understand further. Wrong recall. Okay, please inform me. Yes, Patidar, please inform me what are the option. Please inform me what are the option. Next, which muscle are supplied with the superficial peroneal nerve? So the peroneus brevis and the peroneus longus, they are answer. Remember, peroneus tertius is not the answer. Yes, they given such kind of option 1, 2, 3, 1, 2, 1, 2, 3, 4, 1, 3, 4. So answer is the 1 and 2. What is your answer, beta? Yes, peroneus brevis and the peroneus longus. If there is any problem, you can refer the Gray's Anatomy 42nd edition, page number 1418. The fibularis tertius. Also, you can say the peroneus tertius. Sir, it is clear cut written. The fibularis tertius is supplied the deep fibular nerve, means deep peroneal nerve, and we did this one in our session. Yes, the simple law, Hilton law, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. Yes, the peroneus tertius is the muscle of the entry compartment, so it is supplied with the muscle of the entry compartment, deep peroneal nerve. But the peroneus brevis and the peroneus longus, these are the muscles of the lateral compartment, so these are supplied with the nerve of the lateral compartment, our superficial peroneal nerve. So I think any need is here, any need for the correction? Please inform me. I had put the Gray's Anatomy 42nd edition also, na? Yes, extension at the knee. Gluteus maximus is having no action on the extension at the knee. No action on the knee. Okay. Yes, where muscle goes, there movement flows. Yes. बन गया ना? बहुत बढ़िया. Now there is a question. Olfaction is carried by all except option B are trigeminal nerve, glossopharyngeal nerve, hypoglossal nerve, and the vagus nerve. So this is the old PYQ. This is the old PYQ. Okay, remember this is the controversial question, sir. The olfactory pathway, it is parallel to the our taste pathway. Yes. So according to it, the glossopharyngeal nerve and the vagus nerve, they are having the contribution. Also in our literature, it is given the trigeminal nerve also participate. Yes. The vagus, the hypoglossal nerve is the purely motor. Yes, listen carefully. The hypoglossal nerve is the purely motor. So it is not having any kind of participation in the sensory activity, olfaction. Agree? Yes, yes. Trigeminal nerve. Very good, Vinayak. Very good. Yes, yes. This time anatomy question we are difficult, na? Okay. Yes, yes. Very good, Patidar. Multiple choice. Okay, so please inform me what. Yes, very good, Sopapera. Okay. Now the next question. What is the function of the muscles attached at the mark point? So they ask about our lateral pterygoid plate. Yes, I told you this all the things with our three-dimensional anatomy. Lal full, Neela full, anatomy beautiful. Just see the lateral pterygoid muscle of the mastication. So this is our, yes, you can observe the our three-dimensional anatomy, and here is our lateral part. You can see the lateral pterygoid plate. It is giving origin to the muscle, the lateral pterygoid muscle. This is the muscle. So it is responsible for the DPS. Delhi Public School was the mnemonic. D for depression, P for protraction, S for side-to-side movement. So answer in this question according to the given option. Yes, elevation, depression, retraction, rotation. So definitely the lateral pterygoid muscle was asked. So answer will be the depression. Option is the B. Okay, B. Lateral pterygoid, B. Depression, DPS, depression, protraction, and side to side. Very good, Abdul. Very good, very nice. Not the elevation, Vinayak. Sorry, this time. Okay. Olfactory answer, yes. So remember, not carried by olfaction is not carried by the trigeminal nerve. Okay, so come to here, identify the marked structure. So students, we are saying such kind of the image, but it was in zoomed manner. Again, this is the PYQ. Yes, identify the marked structure. Students, we are saying that arrow was given on the terminal bronchiole. Please inform me, respiratory bronchus was given in the option or not. Students, inform me that trachea, bronchus, terminal bronchiole in the alveoli are given in the option. Okay. Yes, yes. Very good, Patidar. All the muscles of the mastication, they causes the only depression of the jaw, lateral pterygoid. Very nice. Yes, yes. So this is the question related to the gland. Always I told one question from the gland: apocrine, merocrine, holocrine. But this time they ask about the paracrine. This time they ask the paracrine. Look over the question. What does the marked cluster of the cells affect the nearby cells? So this is our NEET PG PYQ. This is the our islet of the Langerhans cells. Yes, this question had been asked islet of the Langerhans cells, but they are asking, yes, holocrine, merocrine, apocrine, paracrine. So this is the question in given option. Paracrine was given. So this is the our physiology integration. So when the two cells are nearby and signaling nearby the cells, this is the paracrine, and when the cell is stimulating the cell, this is the autocrine. So this was also our PYQ, but in a twisted way. Okay. Yes. Very good. This is the pancreas histology. Another question. So this is the your surgery question, ENT integration, but the muscle you have to catch from the anatomy. I taught you the facial muscle expression with the our Hollywood, Bollywood, Tollywood integration, Priya Prakash warrior muscle. Okay. Yes. So which muscle is primarily corrected in the cleft lip? So in case of the cleft lip, there is a orbiculis oris. Yes. Please go with the our clinical subject also, but according to the anatomy, during the cleft lip, this orbicus oris muscle you have to look. Okay, cleft lip, orbicus oris, you have to primarily correct. Okay. Now look here, sir. There was the one image of the posterior surface of the urinary bladder. So I don't know which kind of the image was given. It was a cadaveric image, similar to this, our animated image. Yes, such kind of the image was given. I'm not getting the exact image. Okay. Fine. But if you will observe, can you see this is the our ductus deferens. Here is the seminal vesicle. This finger part is showing the seminal vesicle. This is the posterior surface of the urinary bladder. Okay, this is our bladder part. Again, you can see this image also. Sir, this is the prostate gland. Here is the seminal vesicle, and this is the ductus deferens. According to it, there was the labeling was given. Ureter, vas deferens, seminal vesicle, posterior, prostate urethra, these all are given. No? Okay, so you have to look for this. So I will make the correct framing when I will get the perfect image. No? Okay, this was such kind of given. Can you tell me this was the image? Okay, fine. Are you able to tell me what is this? Okay, so fine. I will frame this question. Please suggest me if any correction is needed. Okay, one more question. The pane from the marked structure can be referred to which of the following? So this is the one question. Again, it is the very old question. Okay, but now again came into the our pattern. So there was the image for the our foramina magna. Can you see the foramina magna? I always told the foramen, they will help you. So this is the foramen magna, and here is the our posterior cranial fossa. They marked here. Okay, yes, they marked here. So they asked the pane from the marked structure can be referred to which of the following? Ear? No, excluded. It is not related with the ear. Back of the neck? Yes. There is the our durameter now supply, and they are supplying the our neck part also. Vertex? So this is the vertex. How the pane of the posterior fossa can go? And D option. I don't know what was the D. Please inform me what was the D. Okay. Yes, yes. Fine. Okay, frontal was there. Answer with the back of the neck. And here is the your literature. I observe from the articles. Okay, neck and back of the neck will be the answer. Now here is the one more question. Cross section of the thorax with 4 labeled A, B, C, D. Match the repair. So I'm again not getting the exact image. I had put the few images here. This one also. And yes, most of the students are saying this was given. And I have to again recreate. Please, can you help me? Yes, there will be the option received oxygenated blood. So definitely the oxygenated blood, they are catch by the our left atrium. Also you can say pulmonary vein lies to the right of the ascending aorta. So it may be the pulmonary trunk. Yes, the undergoes hypertrophy of the pulmonary stenosis. So there will be the marking over the our right ventricle and arises from the left ventricle. So this will be the aorta. So I'm not getting the exact image, exact question pattern. You can inform me. Okay, please inform me at the chat box. Only heart specimen. Okay, so VM Patikar is saying only heart. Okay, not correct. Can you inform me, please inform me? Pulmonary vein. Yes, you are right. Pulmonary vein will be there. Okay, yes. So these are the option. Few questions, maybe options, words will be different. Please inform me at the chat box, or you also you can connect me later. Okay, so this was the my session. Okay, this time anatomy question we are little bit difficult. Approximately 9 to 10 question we are there. Okay, fine. But yes, anatomy is very important. Thank you very much. Any doubt you can ask me. I will share this content at the Insta and the Telegram channel. Okay, thank you. So I'm just asking to the technical team and the respected faculties, please join the session and continue. Thank you.
Dr. Atul sir.
Yes, I'm here joining in a minute.
Okay. Let Dr. Parineet sir can come.
यहाँ पे मिरर स्क्रीन करनी पड़ेगी ना. हो गया क्या?
No sir, not yet. Yes, हो गया.
ठीक है. Hi everyone. Just a second. Let me just start the. I will see the chats also from here.
हो गया क्या?
Yes. Am I audible?
Yes, हो गया.
Am I audible, Shubham?
Yes, sir. Yes, sir.
ठीक है.
Hi everyone.
Just a second. Okay, so I will not take much time. It's your time to chill out, but it will be mostly I will just give the answers, not to explain anything. अभी explain करने का time नहीं है, ठीक है? अभी ये मस्ती करने का दिन है आज. थोड़ी ना दिमाग ही खराब करते रहोगे, क्या ठीक हुआ क्या गलत हुआ. इट्स अ टाइम टू एंजॉय, बट जस्ट हैव द आंसर्स. Previous hurt. Yes, severe pain for 15 days. Pain should be for minimum 15 days, not 5 days. So this is simple. A is the answer. Clear? Second is, this is also very simple, that before 20 weeks, one doctor, 20 to 24 weeks, we need 2 doctors. ठीक है? And after 24 weeks, we need a medical board. Medical board. So here the answer will be 20 to 24 weeks. Is clear? Questions were like this only. Jai Gurudev. Questions are correct. I think these would have already been discussed. MTP wala. So these are all previous year topics, previous year questions. What's the minimum age for MTP? This is a wrong question. Wrong question. There is no minimum age defined as such. But what is defined in MTP Act is that below 12 years, a legal guardian consent is required. So by default, here the answer will become 18 years. As such, the question was wrong. Maybe the examiner who drafted this question was in a lapad jhandu state of mind. But here this will be our best bet. Okay? The best bet will be 18 years. People are studying so much and then you give wrong question. The examiner should understand this. The person who is drafting the paper. आधा दिमाग लगा के क्वेश्चन बना देते हैं. Now, triad of bruise, abrasion, and laceration. These three are the features of, these are Marshall's triad. Marshall's triad, which is seen in secondary bomb blast injury. Secondary bomb blast injury. So the answer here will be bomb blast injury. That's also very simple. Okay. This was asked in the INI-CET November 2025 also. So previous year questions are so very important, as all of the cerebellum faculties emphasizes again and again. There must be some leopard jandu student who would have not gone through the previous year question. Tell me how many of you did it wrong. You did it wrong, that means you didn't do the previous year question. So aluminum phosphide reacts with AgNO3 to give silver phosphide, which is black in color, Okay, so the answer here will be aluminum phosphide. Okay, this was the question. Am I right or wrong? Question was this only, no? Because these are recall. Just let me know. Barbiturate was also option. ठीक है, so let's make it barbiturate. But answer remain aluminum phosphide only. ठीक है? Malathion was also there. ठीक है? Answer will remain aluminum phosphide. ठीक है? Which of the following has poison to their corresponding effect? This is such a simple thing. Organic irritant, it will be croton. So A is 2 croton. Metallic irritant, lapad jandu, chappu question. B 4 lead. Deliriant, we know cocaine, datura, cannabis. These three are deliriants. Okay, these three are deliriants. Depressants, we all know opioid. So this was a very pappu question. Okay, so A 2, B 4, C 3, D 1. Question ठीक है कि नहीं है? At least let me know. पता चले are you guys listening to me? Am I audible or not? Yes तो बोलो जय गुरुदेव अगर सुनाई दे रहा है तो. शिकारी भेड़िया मतलब सुन रहा है. ठीक है. Calculate the percent. This would have been covered in the surgery. Now the problem with these kind of questions is we don't, if there is an issue in the recall, the answer changes. Okay, so I would have this would have been covered in surgery, but I will just cover. I don't know whether it's covered or not. But anterior aspect of chest, that becomes 9%. Both upper limbs, that becomes 18%. front of face and eyelashes. Now, face and neck, actually, face is 7, neck is 2%. So here we can consider it as 7%. Okay, so this becomes 7 plus 9, 16, 16 plus 18, it becomes 34%, something like this. Okay, it becomes something like 34%. Clear? But it all depends that exactly what was asking the question. Both upper limbs were there or front of upper limbs were there. It will all depend upon that, whether it was both upper limbs or front of upper limbs. Tell me. See, the answer will, unless until I know the exact question, I don't know whether the answer is 30% or no. It will all depend that how exactly was the question. Okay. Both upper limbs were there. So both upper limbs will definitely be 18%. Anterior aspect of chest was there. Anterior aspect of chest was there or not? So anterior aspect of chest, that will be 9%. Okay. That will be 9%. And then face, whether eyebrows is of course a part of face only. No. So this you can consider it as minimum 7%. So this become 18 plus 9, 27, 27 plus 7, 34%. So I will mark A as the answer. Okay. Eyelashes is a part of face only. No, face में आ गया 7%. That's okay. Wrong statement with respect to snake bite. Viper bite is vasculotoxic. Yes, that is of course true. Cobra bite is myotoxic. Pappu question we all know. Cobra bite is neurotoxic. Myotoxic is sea snake. Sea snake. Myotoxic is sea snake. Clear? Only front of face. Oh, sorry, only front of face was there. Wait, sorry. Then it becomes 9 plus 18 plus 3.5%. I'm sorry. Then it becomes 3.5%. Only front of face was there. Then it becomes this. So 18 plus 9, 27. Okay. So 27 plus 3, it becomes, the answer becomes C. In that case, the answer becomes C. Only front of face was there, no? So then it becomes 3.5%. The answer becomes 27 to 33%. Okay. Okay. It will become 27 to 30%. See, cobra is same as elapidae. Elapidae has cobra and crate. Cobra is elapidae. So basic thing that you should be knowing is elapidae, cobra and crate. These are neurotoxic. Even if the choices were either, whether the question was, so this will be the answer, whether cobra bite is myotoxic or elapidae is myotoxic. Okay, if the choice was elapidae is myotoxic, then this will be the answer. This will be the answer. Okay, this option, this will be, because this is, we all know elapidae is neurotoxic, not myotoxic. And most snake venom contains hyaluronidase. All was there or most? See, most is actually not very correct, but hyaluronidase is present in most of the poisonous snake bites. So we have to choose the best possible. Elapidae is myotoxic is definitely wrong. Elapidae is myotoxic is definitely wrong. Okay. Now, a lady comes with her doctor to hospital with alleged history of rape of her daughter. Mother says daughter's age is less than 18 years. So basically, you have to determine whether which X-ray will be the best for 18 years. So for 18 years, always remember the most important X-ray is wrist. Most important X-ray is wrist. Lower end of ulna and radius, they fuse near this. But here, wrist was there. So lower end of radius and ulna, they fuse somewhere between 17 to 19 years. Middle end of clavicle, 21 years. 18 years it appears and fuses at 21 years. Sternum fuses, the body of sternum fuses between 14 to 25 years. Middle end of clavicle appears at 18 years and fuses at 21 years. elbow and shoulder was in option. अच्छा मुझे option फिर tell me the option again. I will look at the option again. Elbow and shoulder or wrist and shoulder? Elbow and shoulder. So elbow and shoulder was there. Other choices are correct. Other choices are correct. Wrist, hip, and medial end of clavicle. Wrist, hip, and medial end of clavicle. What else? देखो, even if you don't remember the exact option, the choice will be wherever the wrist was present. Simple thing. Because wrist is the best for 18 to 19 years. Around 18 years, the most important X-ray. And I think all of you are saying that wrist and medial end of clavicle were written together. This is true or not? Wrist and medial end of clavicle was written together or not? So then medial end of clavicle was written. Medial end of clavicle appears at 18 years and fuses at 21 years. ठीक है? So different people are showing different things. Very simple. Wherever wrist was given, you consider that as the right answer. Okay? Wherever wrist was given. Which Indian law protects medical data security? If you know this, then you are a leopard jandus. If you knew this question. At least no forensic teacher would have taught this. अच्छा अभी there is a lag, पीछे चल रहा है शायद. Elbow fuses near 16 to 17 years. So this question was a leopard jandus question. It was should not have been asked. I think only short forms were written, but I will tell you, I never teach this. No forensic faculty will teach this. But since it was sometimes 1 or 2 questions are going to come like this, so don't worry about this. देखो, don't worry. अगर कोई एक आधे क्वेश्चन में it was people are giving me different choice. So DPDP is the answer. Digital Personal Data Protection Act. So this act is basically for protecting confidentiality in India. So it is not only for actually medical data, for any data in India. For example, like your Aadhaar card, PAN card, your age. So main thing is now as the internet world is coming, virtual world, the main thing is your data cannot be used without your permission. And that applies to medical data also and any other data. So for India, we have DPDP Act. It came recently in 2023. And GDPR is the similar act which came in, which is for Europe. That was the first act which came in Europe. And following the GDPR Act, the DPDP Act came in India. PNDT, we all know it cannot be the answer. HIPAA is for USA. HIPAA is for USA. So for India, the answer will be DPDP. ठीक है? Okay, which dental notation is represented in the below layout? There's some lag, so maybe I should go a bit slow. Okay, so which dental notation is represented? So please remember, whenever it is 1, 2, 3, 4, 5, 6, 7, 8, always. So this is Palmer's. This is Palmer's. This is Palmer's. And palm and hand. So you can remember like this. Palm and hand, both are same thing, palm and hand. So header up is similar to Palmer. So suppose you put one plus sign like this. If you put a plus sign, if you put a plus sign like this, sorry, then it becomes Palmer. Sorry, header up. If you put a plus sign, it becomes header up. Universal is simply we go like this from here to here. This is universal. The first one is Palmer. I think this is asking the question. The below one is header up. And the last, where we give every quadrant, we give number 1, 2, 3, 4. These numbers we give 5, 6, 7, 8. This is FDI. So here the answer will be Palmer. A child has, there was, I think 1 or 2 questions were bit googly questions, but I can say that most of the 90% were from notes only, 90 to 95%, rather 95% I will say. So this question was simple question. अब एक दो question तो ऐसे पूछे DPDP Act. You can't even imagine that somebody can ask about DPDP Act. Okay, now so this was a simple question which something on chronic mercury poisoning was asked. I think the choice was some Mad Hatter feature was there. Somebody was saying some Mad Hatter was written. Mad Hatter was written. So which finding will be found? Something related to Mad Hatter will be found. Something related to Mad Hatter or Denbury tremor. That will be the answer. So this was the question. Am I correct or not? Tell me. Mad Hatter was there. Okay, so that will be the answer. Wherever you saw the Mad Hatter is for mercury poisoning. Simple. Okay. Mad Hatter, Denbury tremor, whatever it was, that will be the answer. So which is in, so I think this is more, this was covered in psychiatry. I will not go through it. This was covered in psychiatry. Cannabis, inhalational, I don't know. This was covered in psychiatry. So that's it. So I hope most of you did your exam well. And the notes and the classes helped. I believe so. Most questions were from these, except for एक DPDP और ये एक दो question कुछ ऐसा आया होगा. Thank you so much. Thank you so much. And I don't. So I welcome the other faculty. Dr. Praneeth is there, or Dr. Praneeth.
Yeah. Thank you, sir.
Welcome, sir.
So yes, dear students, the paper was tricky. Actually, the paper is little bit tricky from ENT side. Not easy, at the same time, not difficult. It's little bit tricky. So we'll go with one by one. 6 questions were there from ENT. And incorrect in juvenile angiofibroma, you all know that this is a vascular tumor, so you should not go for biopsy, right? Never poke an angry man, right? Okay, so don't do biopsy in case of vascular tumors like angiofibroma, right? And your, what is also vascular glomus tumors like that, right? Cochlear implant will not be done it. Otosclerosis is a middle ear condition. Why do you want to go for a cochlear implant when inner ear is normal? No. Congenital hearing loss, most of the times cochlea will be having problems, and if it is profound, definitely you will plan for a cochlear implantation. And fixed malleus is again a middle ear condition, and you don't want to go for any cochlear implant there because it's not related to inner ear at all. And ototoxicity induced hearing loss, either your stria vascularis can get damaged by diuretics or your chemotherapeutic drugs can damage your outer hair cells. So cochlea can get damaged. So there you can go for cochlear implant. So if the question is cochlear implant will be done, then the answer is B and D. If the cochlear implant will not be done in was the question, then the answer is otosclerosis and fixed malleus, right? So your otosclerosis is here, fixed malleus is here, and the congenital hearing loss and ototoxicity are here. So these are repairable by regular middle ear surgeries, right? Right, and these inner ear conditions are there. You need cochlear implants, right? Okay. Yeah. Okay. If will be done, then it should be behind. Stridor in a newborn is seen in laryngomalacia. Most common congenital anomaly that is of larynx is laryngomalacia. You will be having inspiratory stridor. That is the only complaint with which the child will be presenting, right? And subglottic stenosis, even more stridor will be there in subglottic stenosis, right? In papilloma is most commonly seen in around 3 to 5-year-old. Hemorrhagic polyp on the vocal cord will just cause hoarseness of the voice. So in both these conditions, you will see this. And moreover, in a newborn, you can't see this hemorrhagic polyps on the vocal cords, right? Okay. Pyriform fossa injured due to fishbone. Which nerve is damaged? See, pyriform fossa is lying a little bit high up, isn't it? See, if you take this one, your larynx. So just if you can remember our diagram during your routine larynx classes, okay? Here is your arytenoid. This is your vocal cord, arytenoid, okay? Cuneiform, corniculate cuneiform. So if I draw a line at the level of the vocal cord, behind the arytenoid is your pyriform fossa. Behind the cricoid is your postcricoid area. And this is your posterior pharyngeal wall, isn't it? Above the level of the vocal cords is supplied by internal laryngeal nerve. Below the level of vocal cords is supplied by recurrent laryngeal nerve. So if you take the piriform fossa, this is supplied by internal laryngeal nerve. If you take the post-cricoid area, this is supplied by recurrent laryngeal nerve. If you take the posterior pharyngeal wall, upper part is supplied by internal, lower part is supplied by recurrent, isn't it? So internal laryngeal will be the answer here, right? Okay. Patient experiencing vertigo and vomiting. Here, this is the catch point. If it has been given on positional change while turning in bed on positional change, if only vertigo was there, then the answer should have been BPPV. But vomiting is also there. The answer goes towards the vestibular neuritis. Even sometimes vestibulospinal tract involvement may be there. Gait abnormalities also you can see sometimes. You give some steroids, it will be clearing very immediately. So don't jump into the answers. Read the question carefully. I told you BPPV only vertigo in BPPV. That was the point we have discussed, right? Okay. So in mean years, mean years involves entire inner ear, not just vertigo. Apart from your vertigo, you will be having SNHL. Same is the case with labyrinthitis. Here also labyrinth means inner ear. Labyrinthitis, inflammation of the entire inner ear. So here also you will be having vertigo plus hearing. But vestibular neuritis, only vestibular nerve is involved. So you will be having only vertigo. BPPV also you will be involving here also. There will be only the otoconia will be dislodging into the canal. This will be disrupting only the cupula and crista there. So only vertigo. But vestibular nerve is involved. It is connected to medullary vomiting center also. So there you will be having vomiting also. Even if still extends down into vestibulospinal tract, you may even have gait abnormalities also. Okay. After ear, yes, this has a lot of students had discussion with this question. After ear infection, child had limb spasm. So a clue was given after ear infection. Yes, tetanus. The main confusion was between tetanus and meningitis, right? In sigmoid sinus thrombosis, no limb spasm at all. And in Bejol spasm, no limb spasm at all, right? The confusion is between these two options, right? So your ear infection is nowhere related to tinnitus. So here you are left over with only meningitis. And someone asked me a difficulty opening mouth. How is this explained? Neck rigidity, due to neck rigidity, indirect. The mouth opening difficulty is not direct, but due to neck rigidity, some difficulty opening mouth will be there. So the answer is meningitis here. Okay. Right. So this ends the ENT discussion. A little bit tricky paper, not so easy, at the same time, not so difficult. Those who were alert and studied line by line, definitely might have answered well. So I will pass this on to the next available faculty. So if no vomiting is okay, you can take over. Take over, sir.
Okay, thank you so much, Pranit sir. Just give me 1 second to share my screen. Yes, okay. Is my screen visible? Yes, please give a confirmation whether my screen is visible.
Yes, sir.
Thank you so much. So all the dear students, I don't want to take your time because since morning you are all very active and very stressed out, most likely. Okay, let us begin our discussion. I hope you have done great because most of them were repeat questions. Few are definitely somewhat tricky and few are, integrated with other subjects like microbiology and also pharmacology. Okay, so this was the image which was given. Many students have shared with me. Patient presents with progressive and asymptomatic lesion over the neck. There is no systemic involvement noted. And what are the investigations you are going to do in this patient? So was this the actual question or yeah, this was a multiple correct answer type question. So I have put it in the brackets. Okay, so was this looking something like this? plaque image was on the neck. Yes. Okay. So whenever you see this kind of a image, which is basically an annular lesion, which is having activity at the periphery, and you are able to see at the center, there is a little bit of scarring. Okay. And it is progressive and mainly it is asymptomatic. So what are the DDs you need to think? We can think of tinea, we can think of lupus vulgaris. Okay, so in this case, the patient, you have to think about lupus vulgaris. And lupus vulgaris, it is the most common cutaneous tuberculosis in the adults. So with that knowledge, we will try to answer multiple correct answer types. So what are the investigations you can do? KOH, if it is a fungal infection which you are suspecting, we will do a KOH. So that cannot be the answer. Skin biopsy, yes, we can do a skin biopsy where we are going to see the granulomas. Chest X-ray, TB workup, yes, that is also going to be done in this case. HIV test, it does not have any role. So we can mark B and C as the correct answer. Yeah, if the image, you feel that it is not this one, any other image was asked, please feel free to, post the image on my WhatsApp number 75025. Or you can also post it in the Cerebellum Academy official Telegram channel and you can tag me. I will take that. Okay. Right. Right. HIV, image not exact lesion. Okay. Yeah, if it was, symptomatic, that is, if it was itchy lesion, which was mentioned in the question, then you can think of a fungal infection, that is tinea. But because it is mentioned as asymptomatic, so because itching is not there, we can rule out the tinea. So KOH is not required. Okay, so why HIV not done? Okay, so Kaposi sarcoma. So some student is telling it was like Kaposi sarcoma. So in Kaposi sarcoma, we are going to see purple colored nodules over the body. So can you please post the image to me? So depending upon the image, we are going to have different answers. Yes, if it was Kaposi image, then the answer is going to be do a HIV test. Okay. Okay. Right. This is the next question. Biopsy of a patient with recurrent painful vesicular lesions. So this is very standard, question, repeat question. Repeated painful vesicular lesions and erosions in the genital area. What is the diagnosis you are going to think of? You need not even see the image. So image is also given where it was showing multinucleated germ cells. Okay, this was the image which students told me was given. So if it was any other image, you can please post it in the Cerebellum Academy official Telegram group, or you can also personally message me. So if you are getting these clues, the diagnosis is going to be genital herpes, which is basically a viral infection, which is caused due to herpes simplex virus type 2. So what is going to be the best treatment option for this patient? It is going to be acyclovir, option A. Okay, option A, acyclovir. Right. Next, this is a, we can say NEET question also was asked previously. So a patient with history of transient genital ulcer 2 weeks back. Now there is a lesion over the palms and soles. And these were the images which students shared with me. So basically you are able to see that there are hyperpigmented patches and also plaques which are present over the palms. So which are the following investigations is used to diagnose this disease? And whenever you see this kind of a scenario where there was a transient genital ulcer 2 weeks back, okay, after which there is a hyperpigmented lesion over the palms, you should think of a diagnosis of syphilis. And this basically is the secondary syphilis stage where the syphilids are seen. And for syphilis, which is produced by Treponema pallidum, what is going to be the investigation which you are going to use? It is going to be BDRL, which is a serological test. So answer is going to be option D, serology. Okay. So in this question, only transient genital lesion was mentioned. So was it so transient genital lesion? Zank was there in this particular question or any other question? Multiple option. So this is multiple option type of a question. So ulcer was not mentioned. Okay. Genital lesion was given. Okay. Any other input? Was it a multiple option correct type of a question? And is it Zank present? Zank is there in the option? Zank there. Acha. Okay. No. Okay, fine. So please, message personally or in the Cerebellum Academy Telegram group. Depending upon the points which are given, the answers are going to differ. So if it is this particular question, then the answer is going to be serology only. Okay. So next is basically local side effects of topical corticosteroids. So one line type of question, but it is a multiple correct answer type. Okay, please correct me if these options are there or if there is anything extra. Okay, so yes, atrophy is one of the local side effect. Acneiform eruption is one of the side effects of topical steroids. Hypertrichosis, that is increased hair growth, is also one of the side effects. Bluish discoloration of the skin, alopecia are not seen associated with topical steroids. In fact, in the alopecia areata, if you remember, we are going to use the topical steroids. Alopecia areata, we use steroids topically. Okay. Right. So this is a multiple correct answer question. So next is correct options should be identified, and this is also again a multiple correct answer type. Epidermis can regenerate from hair bulb and sebaceous glands. This statement is correct. This statement is correct because there are stem cells present in the hair bulb and the sebaceous glands. Stratum corneum is the outermost layer. That is correct. But this cellular part is wrong. Why? Because stratum corneum is a dead layer. So it is a acellular layer. Epidermis is ectodermal in origin. This is a correct statement. Dermis and hypodermis are endodermal in origin. This is wrong. They are not endodermal, they are mesodermal. So answer will be option A and C. Option A and C. Okay. So next, this question, I think it was discussed by Garg sir. So thalidomide, except so it is not going to have an anti-metabolite action. So answer is option A. This is, I think it was discussed by Ranaman, so it is going to be 16 and 18. So it is a very simple logic. So we are going to have all the vaccines which cover the 16 and 18 strains for this same reason, because they are associated with high risk cervical cancer. Most common manifestation in the systemic lupus erythematosus is going to be option B, arthralgia and myalgia. This is taken from Harrison. You can take that musculoskeletal, manifestations, that is arthralgia and myalgia, are the most common manifestation. And this also might have been discussed by Garg sir, so I am not going into the details of this. So yeah, so if there is a patient who is having gram-negative diplococcus, so gonococcal urethritis, what is the most appropriate treatment? So it is going to be ceftriaxone in a patient who is having the resistance to the penicillin. So this is going to be ceftriaxone. Okay, so I hope all the questions were covered. If there are any other questions which are remaining, you can please post them in the Cerebellum Academy official Telegram group, or you can also personally message me on this WhatsApp number. I hope you have got some idea about this particular dermatology. Why not photosensitivity? Because if it was a question which was asking specifically cutaneous manifestation, which was the most common, you can mark the photosensitivity. But here the examiner is asking overall what is the most common manifestation in the systemic lupus erythematosus. So you can see it is basically numerical based, we can say. Okay, right. So why not vancomycin? So I think that was discussed already by Garg sir, isn't it? Ceftriaxone, sorry. Okay. Anything else, dear students? So I have included the ones which are integrated with dermatology, but proper dermatology per se, the questions we can say, there were some 4 to 5 proper. I have also included others to make it wholesome. Okay. So thank you so much, dear students. Please like the video if you have not yet liked it. Okay. And I will give the session to the next person, next faculty. Shubham ji.
Good evening, sir.
Very good evening, Anku Jain sir. Please carry
Good
on.
evening. Thank you, sir. Thank you.
Very
Good
good
evening.
evening.
Okay, friend, first question. It was very simple question. Snowdrop or South ka dosa, North ka roti, West ka pizza. Yes. So answer is C. If person on fat-free carbohydrate-rich diet continues to grow, obese, multiple time question is asked that if a person is taking carbohydrate, the weight is increased. We all know that when we take carbohydrate is coming to pyruvate coming to acetyl coenzyme bind with oxalate to form citrate. Then citrate come out of the mitochondria and fatty acid synthesis occur in cytosol. This acetyl coenzyme is coming to malonyl coenzyme by enzyme acetyl coenzyme. Yes, carboxylase. This is rate limiting enzyme. So in fed state, this citrate shuttle will be increased. This acetyl coenzyme carboxylase activity will increase. Malonyl coenzyme will increase. This malonyl coenzyme will inhibit CPT1, inhibit beta oxidation of fatty acid by inhibiting the transport of fatty acid from cytosol to mitochondria, means carnitine shuttle will be inhibited. Yes. So in this malonyl coenzyme, 90 kg man after eating which enzyme or intermediate will be active causing weight gain, means which cause fatty acid synthesis. Malonyl coenzyme is intermediate of fatty acid synthesis. It is inhibitor of this mitochondrial transport of fatty acid. This is not, yes, this is activated. Acetyl coenzyme carboxylase is activated. Citrate shuttle, yes. So answer is yes, 1, 2 and 4. 1, 2 and 4. Yes. Citrate shuttle. This citrate shuttle is also increased. Okay, dear? Which of the following is not aneuploidy? You all know Down syndrome, 21 trisomy, 13 trisomy, XXY trisomy. Yes, Bloom syndrome. We have discussed homogeneous. घर में क्या करते हो, झाड़ू लगाते हो. This is DNA repair defect. Ataxia, आटा, तेल. अपनी मैगी खुद बनाता हूं मैं. झाड़ू, बर्नर, रोटी. मूड नहीं है वाइफ का तो रोटी भी खुद बनानी है. We discuss this. Okay. Definitely it was little bit. Yes. Next question, after how many cycle PCR will get half the copies of that after 26 cycle? Yes, you know, after each cycle, number of copies are double. 1 to 2, 2 to 4, 4 to 8 in this way. Means number of product would be 2 to the power n, means n is equal to number of cycle. If 26 cycle, so after 26 cycle, the number of product would be 2 into 20, 2 की power 26. So I can write it as 2 into 2 की power 25. So half of the copy of the after 26 cycle would be, yes, half into 2 to the power 26. So half is into 2 into 25. So 25 हो गया यार, बड़ा आसान है. ठीक है. 50 हो, कुछ भी हो, हमारा आंसर तो 25 है. Our answer is 25. Okay. So simply, after each cycle, number of copies double. So in half, less than one cycle. 26, 25 में less than half of 26 would be there. Phenomena of cancer cell consuming more glucose. Because, yes, we discussed Warburg effect. You know, yes, I have given, although we have discussed in detail, but I have given this Harper picture. In cancer cell, Warburg effect, the end product is lactate due to metabolic reprogramming. Yes, ये तो हमने रैपिड रिवीजन में भी किया था अभी. Marathon maybe. Yes, lactic acid is produced. Lactic acid is produced despite presence of oxygen due to metabolic reprogramming. Means we found that this pyruvate kinase, next time they can ask, it is a tetrameric form in normal cell, high catalytic activity, while pyruvate kinase PKM2 dimeric form, it is dimeric form, low catalytic activity. Ultimately we say aerobic glycolysis in cancer cell, and product is lactate. So there is end product is lactate despite presence of oxygen. So absence of oxygen ruled out. Yes. Increase pyruvate to acetyl coenzyme. No, pyruvate is coming to lactate, not acetyl coenzyme. High NADH NAD ratio. Few students told that this was the option. Yes, NADH would be low. Why? Because when pyruvate is converted to lactate, NADH is converted to NAD. Okay, so this is false. Enhanced conversion of glucose to pyruvate. No, it is converted to lactate. Yes, false. So answer is A. Next question. Glucose 6-phosphate dehydrogenase deficiency table was given. Exact what was the table we don't know, but yes, if it is in the form direct bilirubin would be normal. Hemolytic anemia, yes, in medicine you have read in detail. Yes, increased indirect bilirubin, increased urobilinogen will also be increased. GLUT2 was one option. Glucose transporter 2, yes, that is glucose transporter 1, which is more prevalent. Basic glucose uptake is done by glucose transporter 1, not by glucose transporter 2. If option GLUT2 is given, that is also wrong. Okay, yes, Prachi. Now a patient, this is little bit new question, or you can say many times. Please tell me the language. Presented with hepatosplenomegaly, hypoglycemia, means liver glycogen storage disease, glucagon administration, there is improvement in blood glucose level after meal. However, there is no improvement in blood glucose level after overnight fasting by glucagon administration. Liver biopsy showed increase abnormal glycogen. If abnormal word is given without second thought, answer would be debranching enzyme, because you know mnemonic is A, B, C, D. Anderson disease, branching enzyme is deficient. Cory's disease, debranching enzyme is deficient. Yes, debranching enzyme is deficient. So I told you in marathon also that if in any question you find the word abnormal glycogen in liver without second thought, answer would be either Anderson or Cory's. In this only debranching enzyme is given, answer is this. Other than that, one important point they have highlighted, yes, that no improvement of blood glucose level after overnight fast. Giving glucagon challenge test. Glucagon, if glucose 6-phosphatase is deficient, if you give glucagon, no increase in fasting or fad state. But in Cory's disease, in fad state, after giving glucagon, glucose will increase. But in fasting state, glucose will not increase. Okay, this glucagon challenge test is done to differentiate between Cory's disease, sometimes Cory's disease, and von Gryke's disease, that is glucose 6-phosphatase. Muscle phosphorylase, you can easily, yes, if abnormal is not given, even then by this line you can mark the answer. Yes, then it was difficult question. Answer was debranching enzyme. Okay, yes. Yes, muscle phosphorylase, not. Okay, now we come to this. We found that glycine, amino acid H, this is glycine. 2 ionizable group. We know that whenever amino acid there is NH3 plus COO minus, both positive charge and negative charge in equal amount deuter ion, and we found that at a particular pH the net charge on deuter ion is 0. That is isoelectric point. So isoelectric point Pi is equal to pK1 plus pK2 divided by 2. So dissociation constant of this and dissociation constant of this, if you take average, you will find Pi. But in this graph, how you will identify? What is PK? Dissociation constant. Buffer is most effective. Buffer is most effective at pH equal to PK. Means at which pH buffer is most effective, equal, that is PK. So I can say that if I add NaOH alkali, NaOH or alkali, at this point you will find a flat line, means no change in pH, means that is buffering. So 1 pK is this pK1, flat line, this is pK2. So Pi would be pK1 plus pK2, 2.4 plus 9.6 divided by 2, that is 12 by 2, 6. Yes? Okay. So definitely they will give you, the concept would remain same. There would be no change in pH. At that point, that would be dissociation constant. Okay? PK1 and PK2. Clear? That is good. So average. So Pi is average of PK1 and PK2. The answer is 6. Which of the following is not able to take up glucose in the absence of insulin? Yes, you know insulin. We know insulin increase concentration of glucose transporter 4 at, we remember, पोपाई द सेलर मस्कुलर मैन, हार्ट 4 चैम्बर धक 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 करने लगा लड़की का. यस, सो ग्लूट 4 हमने निमोनिक बनाया था, एंड दैट इज एडिपोज टिश्यू. एडिपोज टिश्यू शादी होने के बाद एडिपोज टिश्यू आ गया. सो इंसुलिन इंक्रीज कंसंट्रेशन ऑफ ग्लूकोज ट्रांसपोर्टर 4 एट एडिपोज टिश्यू, skeletal muscle and heart. So after overnight fasting or in diabetes, glucose transporter 4 concentration will decrease at adipose tissue, skeletal muscle and heart. Yes, even if liver was there in the option, liver, then answer would remain same. Okay. Yes. Now, patient with hepatosplenomegaly, cherry red spot at macula, we have discussed Niemann-Pick disease. Niemann-Pick, big was there. Big means hepatosplenomegaly plus cherry red spot. Yes, cherry red spot. So in this hexosaminidase Tay-Sachs disease, in this tiny organ, no hepatosplenomegaly, so this can be ruled out. Glucose 6 phosphatase, this was, yes, this is glycogen storage disease type 1, so symptom would be totally different. Galactocerebrosidase, that is Krabbe's disease, in which, you know, मैंने बताया था Krabbe's कैकड़े की तरह सूखा सा, no hepatosplenomegaly, splenomegaly. So this can't be answer. Answer is A. Option was aryl sulfatase, that is metachromatic leukodystrophy. Metachromatic leukodystrophy, in which no cherry red spot. Neurological symptoms would be there. Neurological symptoms present, no cherry red spot, no hepatosplenomegaly. Okay. Glucocerebrosidase, if glucocerebrosidase, you know the symptoms, they are crumpled tissue paper appearance and different symptoms, you know. Okay. Carbon monoxide and cyanide lead to death. ये same question. Yes, cyanide and carbon monoxide. That is IDE. Complex 4 is inhibited. Cytochrome C oxidase is there. Okay, so thank you. Answer is A. Thank you. So now we are waiting for the next faculty. So best of luck.
Right. Thank you, sir. Thank you very much. I'm sharing the
evening, ma'am.
screen.
Welcome.
I hope it is visible. Please, someone confirm from the team if it is visible. Let
Yes,
me
ma'am.
open just, I have just finished the class, right? So just give me a minute, right? Give me a minute to recollect everything. And I have collected the question very suddenly. I'll just open your YouTube chat and will be able to continue. Okay. I hope everything is good. हाँ फास्ट करेंगे अभी तो आई हूँ अभी मेरे को दौड़ा दो तुम लोग हाँ लास्ट सेशन है यार चिल मारो थोड़ा सा ठीक है जस्ट गिव मी अ मिनट लेट मी रिकॉल all right, so everything is fine. Everything is visible. Let's start with the question. First, what is the tetanizing frequency if a muscle contraction period is 40 millisecond? So how do you calculate tetanizing frequency? 1 upon contraction period. This 1 is a complete second. Please remember that, right? They have given 40 milliseconds. So you have to convert that 40 milliseconds into seconds. So that is going to be 0.04 seconds. So 1 upon 0.04 bolo, ya fir 100 upon 4 karo. So what is going to be the answer? It is going to be 25 hertz, 25 hertz, right? So I hope this is audible. Yes. So this is going to be the answer over here. Which of the following pulse is based on the Frank-Starling law? Frank-Starling law says what? Input is directly proportional to the output, isn't it? What is the input? Input is nothing but the venous return. Output is nothing but the cardiac output. And you know, whenever the venous return is going to come in your right atrium, what is going to happen? It is going to cause, it is going to either stimulate or it is going to inhibit the SA node directly. It is going to affect your SA node. And please remember, it is going to affect the ventricular filling, and because of which you're going to have pulsus alterans. Actually, it should be atrial filling, right? So pulsus alterans is going to be the better answer, right? If I have any question, I know, beta, right? 5 बजे से मेरी भी क्लास चल रही है. We'll finish in 5 minutes. Don't worry. है ना? Basalt Jarish आ गया, right? Basalt Jarish. What I told you, Jarish. So क्या mark किया? Hypotension, bradycardia, and respiratory rate is going to decrease. So hypotension, bradycardia, nothing is going to increase. Basalt Jarish, bizarre चीजें दोगे, alkaloid चीजें दोगे, सस्ते नशे करोगे. You're going to have decrease in the blood pressure, decrease in the respiratory rate, and decrease in the heart rate. That is going to be bradycardia and hypotension, which is going to be correct over here. Tight junction are located. Tell me if everything is correct. है ना? Tight junctions are located. See, tight junctions are going to be between two cells, right? And I do not want to allow the paracellular transport. Paracellular transport allow nahi karna hai, and that's why I'm going to have that on the apical side. Of course, between two cells, that means laterally to hai. It is not going to be basal, right? It is not going to be apical. I have to prevent the paracellular transport, so it is going to be apico-apical, right? Hypopnea was one of the option, is it? Hypertension or tachycardia में से क्या नहीं था बेटा? Mukul, Parul, Ritik, Ayush. Hypopnea was the option. Yes, if the hypopnea will be there, then add the hypopnea also. I'll correct that. Okay. कौन सा वाला option नहीं था बेटा? Which option was not there? Bradypnea or hypopnea was there? Then it is going to be bradypnea. Bradypnea, हाँ option में. You have to include that also. Everything decreases. 3 things decreases. That is the triad. Okay. Okay, hypertension was not there. Okay, instead of hypertension, we had a bradypnea or hypopnea. ठीक है, done. Thank you very much. चलो आगे बढ़ते हैं. If any other options were wrong, please let me know. I'll correct it accordingly. Okay, चलो fast करते हैं. High altitude. When you go at a high altitude, there will be hypoxia, and that's why what the patient will do. Patient will start respiring quickly. So what is going to happen? Of course, there is hyperventilation, and hyperventilation se kya hoga? Of course, you're going to breathe faster. So increase in the inspiration as well as increase in the expiration. And when you increase expiration, there will be increased CO2 washout. CO2 is the main stimulus. If more than CO2 washout is going to take place, that means acid is going out, alkalosis is going to be there, and this is because of the respiratory system. There is no problem in the kidneys per se, right? And I'm going to mark it as respiratory alkalosis, right? The options were simple and this question was simple. I hope this is correct. Okay, this was the question. I hope everybody, this is correct. All right. Hypertension was not there. I marked that. Okay. Let me know if the question was correct. What is seen in the high altitude? High altitude, you're going to see the respiratory alkalosis because of the carbon dioxide washout. Next, surface tension in the alveoli increased during pucha hai. I told you, if I have, let's say, 10 molecule of surface surfactants, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You can see there is an air-water interface. They're packing together. This is a deflated alveoli. That means during the expiration. But if I draw the same surfactants over here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There is a lot more space available to interact the air and water. Air-water interface is going to be high. Air-water interface means the surface tension is going to be higher during inspiration. It does not change on the position. It does not change on the position. Rather, it is going to be affected due to concentration of the surfactant. We have discussed that multiple times, right? Because during the inspiration or inflation of the alveoli, there is a decrease of concentration of surfactant per unit area. Remember that. And that's why you're going to have higher air-water interface. Higher is going to be the surface tension. Higher is going to be the surface tension. Next, which is responsible for explicit memory? I told you, when the person expire, you declare the patient. That means they're talking about declarative memory. Declarative memory is of two types, events or facts. Facts is going to be because of frontal and temporal. दोनों ही option में नहीं है. It is facts, that is frontal. I told you prefrontal cortex and temporal lobe. दोनों ही option में नहीं है. Both of them are not in the option. So I have to go with the episodic memory. Episodic memory. I told you, you remember one episode, neo, tempo, hippo. So neocortex, temporal lobe, and hippocampus. Right, these things are important, and out of it, I have the hippocampus into the option. Cerebellum was one of the option. Does not matter, beta. Amritansh, even if the cerebellum is there, cerebellum is not going to help me in the declarative memory. It is going to help me in the non-declarative or implicit type of memory. Skills mein wo, that is going to help me out. Procedural memory mein, it is not going to help me out. Cerebellum tha, Amritansh, to kya nahi tha, beta? What was not there in the option? Please let me know. Okay. Conditions may be, conditional memory, classical conditioning may be, cerebellum is going to help me out, but that is a part of implicit memory, not the explicit. All right. Feed forward mechanism, aate hain us pe. Center, which causes fever during infection. Fever means what? Increase in the body temperature. No, increase in the body temperature. What I told you, increase in the body temperature. In that, posterior nucleus of hypothalamus is going to help me out, right? And decrease in the body temperature in the hot environment, anterior nucleus of the hypothalamus is going to help me out. Para nucleus, paraventricular nucleus releases oxytocin, and it is important for the autonomic nervous system regulation also, but not in the temperature regulation. Dorsomedial is mainly going to be important for with the lateral. It is going to cause satiety also, but it is not going to help me in the temperature. Amygdala to role hi nahi hai temperature mein, so it is going to be hypothalamus. I hope any nucleus was given. If it is the nucleus, then it is going to be. Acha, cingulate gyrus was not there. Okay. All right. Yes, it was there. So fever. Right. So hypothalamus was not there. So kya option mein tha beta? What was there in the option? There must be some nucleus which must be given to the option. है ना? ओके डॉर्सल न्यूक्लियस था, डॉर्सोमीडियल नहीं था. डॉर्सल बोलो, पोस्टीरियर बोलो, बात एक ही है. एंड इफ इट इज नॉट देयर, सेरेबेलम था and the hypothalamus was not there in the option and dorsomedial nahi tha, dorsal tha. Dorsal bolo, posterior bolo, ek hi baat hai. So I'm going to mark then as a dorsal nucleus. If hypothalamus was not there in the option, cerebellum was there, mark the dorsal nucleus. Dorsal posterior ek hi baat hai. ठीक है? Okay, okay, चलो आगे बढ़ते हैं. Patient asked to close his eyes and then reopen it. पहले close था, फिर reopen किया. Now, as soon as he reopens it, which of the following EEG wave shows the decrease upon the eye opening? What is the wave which is going to decrease? Opening may, which is going to go? Opening may, you're going to have a beta wave and alpha wave will be gone. Eyes closed, patient is awake, meditation position, alpha waves, right? So that was there. Okay. Chalo. Next, let's move on to the next question. Which of the following example is of feed forward? बड़े लंबे टाइम के बाद INI-CET ने feed forward पूछा है. I told you temperature is both. If it is a core body temperature, you are going to have the feed forward. If it is a shell body temperature or skin body temperature, it is going to be negative feedback mechanism. Negative feedback. Feed forward में the correction is going to occur. It's anticipatory, na? Correction is going to occur even before the variable has been changed. Right, even before the variable has been changed. So, if they are asking about after, see, vasoconstriction after the exposure of cold, after hai to nahi hoga na. After the exposure of cold, that means it is occurring after the stimulation has been given, after the variable has been changed. So it is going to be feedback again. Increase in the heart rate on standing from the supine position. Again, you are standing. That is going to be the acting as a stimulus. Before standing, it started to prepare, or before doing the exercise, it started to prepare, then it is going to be feed forward. But they are asking after giving the stimulus, feedback. After giving the stimulus, feedback. Okay? क्या था फिर ऑप्शन में और क्या था? Temperature not there in the option, तो ऑप्शन में क्या था? Shall be all to correct, incorrect नहीं हो सकते. Give me the options then. Give me the options. We'll discuss it over here. Okay? Increase in the cardiac output in the response of anemia. Response पूछा है, after पूछा है. This is not going to be true. All right. So temperature नहीं था, तो what was there in the option? Temperature था, temperature नहीं था. Okay. Deepak will come on to the next question. इसके options बताओ. What was the option in the feed forward mechanism? Feed forward was there. Because in both the WhatsApp also and on the Telegram also, I got that. Vasoconstriction of the vessel. Vasopressin in the dehydration. Was that the option here? What are the other options? What are the other options? Okay, this was not there. What was the other options? Vasopressin was there. But vasopressin ke liye bhi also you require a stimulus. You require a stimulus. Vasopressin cannot be the answer. Anticipating the cold. Kartikeya, was that the option? Okay. Kartikeya is saying constriction in the anticipation. Agar word mein hi diya hua hai anticipation, to yahi answer hoga. Anticipation of the cold. But hota nahi hai aisa usually, but theek hai. If that was the option given, anticipation likha hi hua hai, to baat hi khatam na yaar. ठीक है. Dehydration again a stimulus. What are the other two options then? Other two options are correct. Other two options are correct. Feed forward में vasopressin, but vasopressin के लिए you require a stimulus. Without the stimulus, it is not going to get activated or released. After the dehydration, okay, ADH. After the dehydration. After दिया तो बात ही खत्म यार. After means you're giving the stimulus. This was one of the option. Was it the option in response to cold tha या anticipation cold tha? Then what was the other option? Feed forward का other option क्या थे? Other दो options बताओ. Is it correct? Anemia and supine position वाला correct है? Is it correct? Controversy. All right. Chalo, let's move on and I'll collect the correct options and then we'll come back to this. Now, FEV1 percentage was reduced. Chalo, आगे बढ़ रहे हैं. Okay, next question. FEV1 was reduced and they have asked in age of the patient was 42, ऐसे कुछ दिया हुआ था, right? And they have asked which of the following is true. Air trapping means it can be because of the obstructive lung disease. One of the obstruction is going to be emphysema. Remember, if FEV1 is decreased, I told you it must be the obstructive lung disease in which it is going to be decreased, right? And air trapping ho raha hai, that means the patient is going to have obstructive lung disease. I hope one of the student told me, ma'am, COPD was there in the option. I hope COPD was not there. Even if the COPD is there or air trapping is there, the answer is going to be this. It is not going to be age related. Okay, age related में कभी भी air trapping हो सकता है, but that is not going to be the obstructive वाला problem. Both are going to decrease there, right? So reduce compliance नहीं होगा, increase compliance होगा. Restrictive में it is going to be increase. It is going to be increase. Air trapping plus hyperinflation था. Okay, obstruction नहीं था plus hyperinflation था. So that is going to be the one. Most appropriate answer over here. All right, just give me a minute. Next, IGF-1, IGF-2, structurally most similar to. See, it is similar to insulin, but it is more similar to the pro-insulin. What is the pro-insulin? Where you have the N-terminal attached and you have that connecting peptide attached, right? So it is going to be the most, you can say, it is going to be the connecting peptide. C-peptide is attached to it. So that is going to be the most structurally similar to this. Obstructive plus hyperventilation tha. Okay, ठीक है, I'll correct it. Dheeraj, thank you. All right. So obstructive दिया है तो वही आंसर हुआ है ना. So pre-pro नहीं होता, pre-pro में N-terminal होता है, that is not there. Pro-insulin में connecting peptide attached होता है, so it is most commonly resembles to the pro-insulin. Next question. Which of the following is not the mechanism of action of antidiuretic hormone? Water reabsorption कर रहा है basically. Antidiuretic hormone is water reabsorption. That is the work, right? And if they ask increase in the urea in the medullary collecting duct, increase absorption of the urea. See, urea is going to go via carrier-mediated transport. So if you are reabsorbing more water, you have to maintain the tonicity also in the medullary interstitium can be possible because this is not per se related to the ADH. It is related to the tonicity change that is going to be caused by the ADH. Decrease absorption of NaCl in the ascending limb of loop of Henle. Now remember, it is not an action of antidiuretic. Direct action to koi bhi nahi diya hua hai. Increases water permeability, that is true. But they have asked what is not there, which is going to occur. Decrease absorption of NaCl. If you want more water, that means there must be hypertonicity in the plasma, which is present. To cure that or to compensate that, we are going to decrease the absorption of NaCl. That is the indirect effect. It is not the direct effect, right? But they have given the increased absorption of urea in the descending limb of loop of Henle. Descending limb of loop of Henle is not going to be descending limb of loop of Henle will not be permeable for urea, and that is going to, even if it is there, it will secrete it, not reabsorb it. So this is going to be the option. This is going to be the option. Okay. Which of the following best explains the development of hyponatremia and hypovolemic, hyponatremic patient in the diarrhea? क्या explain कर रहा है? Decrease in the reabsorption of sodium. क्या already hyponatremia है? The kidneys will try to gain more sodium as much as possible. Secretion of aldosterone will not be decreased, it will be increased. Non-osmotic release of ADH, that is going to be true because there is a hypovolemia also. Hypovolemia is going to stimulate the ADH. Decrease sodium absorption, no, it is going to increase because there is hyponatremia. and we want to compensate that. Okay, which of the brain region associated with explicit? We have already done that. This is going to be hippocampus. Hippocampus. So that is all from my side. Hai na? You don't have a patience, so that is all from my side. Let's collect whenever I get time or you get time. Please let me know the options which were correct or any other question was there. Okay, chalo. So that is all from next side. Team, let me know if any other faculty is waiting. I'll stop sharing the screen. Okay, if any other faculty is there, kindly take over. Rajita, okay. B option में loop of Henle, it was collecting that. Okay, I'll check that. Any other option were different? Yeah, I'm also waiting for the next subject.
Ma'am, this is the last subject.
All right, so can I end it?
Yes, ma'am.
All right. So I hope everybody had a nice exam. Even if not, you cannot change the past now. So what you're going to do right now, rest and chill maro, relax karo, eat nice things and sleep well, right? We are going to meet in a proper session, right? And I hope we are going to meet in your felicitation ceremony. All right. So that is all from our team also. All right. Take care. And all other whatever subjects has been left, the teachers must be busy in the other classes. The recording will come in the app. All right. So good night.